Good morning, everyone. Today is our board meeting. It is 9:02 a.m. We will now have a moment of silence for silent reflection or silent prayer. Thank you. I'd like to invite at this time our new and very wisely selected CAO, Mr. Jay Wolverine, to lead us in the Pledge of Allegiance.
Thank you, Mr. Chair.
Public. Justice for all. Thank you, CAO Wolverine. For the record, this is the regular board meeting of April 6, 2021. Madam Clerk, roll call, please.
Supervisor Miller? Here. Supervisor Nguyen?
Here.
Supervisor Villa-Poudois? Supervisor Rickman?
Here.
And Chairman Patty?
Present. Thank you. At this time, we have recognitions and presentations. First one on the list, and one of the most important we could have, is the Child Abuse Prevention Council. This is Child Abuse Prevention Month. Madam Clerk, please introduce the proclamation.
Thank you, Chairman Patty. As you mentioned, our first item on the agenda today is the proclamation of April 2021 as Child Abuse Prevention Month in San Joaquin County. And I would like to invite Linda Turner-Hardin, Executive Director of the Child Abuse Prevention Council, Shauna Bazunas-Jacob, Development Director of the Children Abuse Prevention Council, Chris Woods, Director of San Joaquin County Human Services Agency, and Kathy Long-Page, San Joaquin County Office of Education's Coordinator for the Council of Quality Education and Care of Children, Children's Services Coordinating Commission, and the CDRT to receive the proclamation.
Thank you, Madam Clerk. Good morning. What a pleasure to have you here today, and it's our honor to recognize and give this proclamation. Whereas child abuse and neglect continues to possess a serious threat to our communities, children, and whereas child abuse is a community problem and finding solutions depends on the involvement of people throughout the community, and whereas all victims of child abuse, whether physical, sexual, emotional, gross neglect, or exposure to domestic violence, should have access to a safe place to live, appropriate medical care, and counseling or mental health services. And whereas parents, guardians, family members, foster care providers, child care providers, educators, law enforcement personnel, medical professionals, mental health professionals, social service providers, and the public all play an important role in working collaboratively to prevent child abuse and neglect. And whereas the state of California has proclaimed April as Child Abuse Prevention Month. Now, therefore, be it resolved that this San Joaquin County Board of Supervisors does hereby proclaim the month of April as Child Abuse Prevention Month in San Joaquin County and encourages citizens to work together to support youth serving child abuse prevention activities in their communities and schools during this month and throughout the entire year. Presented this 6th day of September 2021. Would you like to say a couple words?
Yes. Actually, you know, as in our normal form, we always say more than a couple words. So we have some children here who, Kim, you want to bring them up? And Blanca and Arani. We couldn't bring our normal passel of 40 kids for obvious reasons, yes, sadly. So we just have a couple, probably really scared. And they're going to share something.
Today, our Carolina.
Thank you, Kim. Chairman, can we get a picture of you with the kiddos? Are you comfortable doing that? And Ladies, if you want to get in there with them. And Chairman, we just have a few things that we'd like to share with you.
You have reached
Kathy, who is from the
I am out of the
Children's Services
office for an
Coordinating
undetermined.
Commission. Oh. And Dickie Pride-Polk, yeah, who is from Child Welfare at HSA. And together we're going to share some information with you. Chairman Patty and respected board members, thank you for this opportunity to focus our time and attention on a public safety issue that is preventable, called child abuse. Yes, child abuse and neglect are preventable, yet each year in the United States, close to 1 million children are confirmed victims of child maltreatment. And here in San Joaquin County, 4 children are abused every day. And now we're not talking about the bad parenting that you see in Walmart or in Target or in the grocery store. We're talking about clear, compelling evidence of abuse. In 2019, there was 1,189 substantiated cases of abuse, all at the hands of their caregivers. This means that by the end of today, another 4 children will have been abused right here in our community. Another 23 by this time next week, and more than 1,000 children in our community by this time next year will be abused.
And tragically, in 2020, 2 children in San Joaquin County died at the hands of their caregivers, and 5 children died by suicide. Just since January 2021, just 90 days, 4 children have died by suicide. The previous year, we saw 3 deaths by child abuse and 1 by suicide. We're trending in the wrong direction, and yet we know that child abuse is preventable, and vast bodies of research point to programs and services that are effective in reducing the occurrence of child abuse, and we need more of them.
The COVID-19 pandemic had a devastating effect on the safety of our community's children. In March of 2020, allegations of abuse and neglect dropped by 50%, an indicator that those individuals who would normally be in contact with at-risk children no longer had contact with them. Since then, we have seen an uptick in reports, but the news is still not good. Unfortunately, child abuse continues to exist, and the cases we are seeing are far more serious and require a greater level of intervention.
For many children, these effects extend far beyond childhood into adolescence and adulthood, potentially compromising the lifetime productivity of maltreatment victims. Recurring abuse interrupts neurodevelopment, which manifests itself in social, emotional, and cognitive impairment, the outcome of which is the adoption of health risk behaviors, which can result in disease, disability, and social problems. And the costs of responding to the impact of child abuse and neglect are borne not only by the victims and their families, but also by society. But the intangible losses, the negative toll on human capital, in fact, may represent the largest cost component of violence against children and should be taken into account when allocating resources.
And while we cannot deny the economic and far-reaching negative impact of child abuse, we must also recognize that all of the public safety issues facing our community today, this one, child abuse, is preventable. These wide-ranging health and social consequences underscore the importance of preventing ACEs before they begin. Safe, stable, and nurturing relationships and environments can have a positive impact on a broad range of health problems and on the development of skills that will help children reach their full potential regardless of their exposure to trauma.
So in celebration of April as Child Abuse Prevention Month, we have to take a moment to reflect on how we're doing here in San Joaquin County. The CDC identifies a number of strategies that agencies here in San Joaquin County have already adopted in our efforts to prevent ACEs, adverse childhood experiences.
The Human Services Agency partners with the Women's Center and a Child Abuse Prevention Council on a safety net program that targets services and support to families that have been reported to child welfare with allegations of abuse, but do not reach the risk threshold that warrants child welfare or law enforcement intervention or removal. The intention is to intervene with assessments and bring resources and skill building with the goal of strengthening the family, resulting in stabilization. Additionally, HSA is partnering with First Five and a Child Abuse Prevention Council to raise our community's awareness of the role they play in reporting child abuse by engaging in a media campaign that presents a compelling message of prevention and protection.
Our approach to child abuse prevention must be system-wide. Child welfare, child support, the Office of the District Attorney, education, law enforcement, public health, behavioral health, all of these systems need to work together in full transparency for the good and safety of our children. And this should not be an afterthought, a bottom of the funding stream kind of thing. It would be a nice to do goal. Our obligation as adults and individuals with a say in how things should be have an ethical and moral obligation to our children. And when we say our children, we don't mean that quite literally. We mean it as a community, because children are children, no matter who they may have been born to, and our obligation does not and should not stop with our bloodline.
Each of us have an obligation to report something that we see, hear, or feel in our gut that makes the hair on our back of our necks stand up, or even just makes us look twice. Report it. It is our ethical and moral obligation.
Nelson Mandela observed that there can be no keener revelation of a society's soul than the way in which it treats its children. 17 more abused children by next week, and more than 1,000 more abused children by this time next year. We can do better, and we must do better.
Child abuse can be prevented, and it's only up to us, and you as the Board of Supervisors can help lead the way by making our children a funding priority. And so, just on behalf of everybody here, I can't tell you how pleased we are to see an item on your agenda today that is directing COVID funding to children and families, and we're very grateful for that. Thank you so much for your commitment to the children of our community. I do want to recognize Chris Woods. I don't know if he's in this room or if he's in there. Chris, thank you very much for your cooperation. And then also Shauna Bazunas-Jacob, who is our development director for CAPC, Cassie Lowe, who is our program director, and Jean Harden, who is the director of the LISA project. If you've never seen that, please give us a ring. We'd love for you to experience the LISA project and learn more about child abuse and its effect on our community. You have in front of you a little package with all kinds of goodies, and we hope that you will display it. Can't blow on it right now, but you can take it outside and wave
We
it
can
around.
run around the room, though, with it, can't we?
Yes,
It'll
you
twirl.
can. Chairman Petty and respected board members, thank you very much for your time today.
So hold on where you are, because I know that some board members may have a couple of words of appreciation. Supervisor Rickman.
Good morning. Thank you all for being here this morning. And to the little ones, awesome posters. Child abuse is a problem and continues to be a problem. And you mentioned, during the pandemic, as one of the things that have concerned me is, when kids haven't been in school, and the cases of child abuse has been underreported. They were talking about because a lot of kids report child abuse in the school setting. And so I just want to thank you for you guys' hard work and your continued dedication to the entire San Joaquin County community. Again, thank you guys very much.
Supervisor Villapudua.
Thank you, Chairman. Well, ladies, I just want to thank you for all the hard work you do for our children. Everybody loves children, and poor kids who are child abuse. It's a horrible, horrible thing, but there's a lot of good people. You need a big heart to have this job, to put up with it, and thank you for everything you do for our children in our community and for all the kids in the world. Thank you.
Vice Chair Wynn.
Thank you, Mr. Chair. Well, your work has been going on for decades, so, this is something that's not brand new, but you've been dedicated in your staff and those volunteers have done an outstanding job. I think sometimes what we forget is that you deal with the worst situations of child abuse that come to your attention. And as you talked about, who knows what's out there, because we don't have necessarily the reporting pipeline that's been available in the past. But on the other side, and following up on Supervisor Rickman's comments, this pandemic has been devastating on our children. And although it may not rise to the level that you deal with in those situations, it is unfortunate that our youth are being disadvantaged in their education, in their socialization, and a lot of things. You talk about the number of suicides and things like that. Those things shouldn't happen, and I know they're going to happen no matter what. But I think that what you do is obviously an opportunity to really reduce the numbers, to make sure that our children are taken care of and that they are treated in a fair way by their caregivers or parents or whoever. And so I want to thank all of you for the job you do and appreciate the difference you make in our community.
Supervisor Wynn, thank you very much for that. I do want to point out the CPC has amazing staff. County Office of Ed has amazing staff too. I think some really unsung heroes here today are our CPS social workers who on a daily basis are exposed to this kind of trauma. And we refer to that as secondary trauma, and that really takes a toll on you as an individual. And I don't think that our social workers with child welfare get enough recognition for the really, really tough work that they do every day. So kudos to you guys.
Supervisor Miller.
Thank you. Well, as always, we're happy to make this proclamation, but over the last 6 years working with all of you, it's been a real joy and a pleasure for me. The dedication and the expertise and the compassion that all of you, including all of your colleagues within the various school districts and with our community-based organizations, all of you putting our kids first, it's wonderful to see. I wish we didn't need it, but we do desperately. And so today's item is just a small, actually drop in the bucket to address the need, the really pressing need. And we talk about suicide being preventable, but the largest percentage of kids who are impacted by this, it's not the most violent, egregious, what we think of as child abuse. The largest portion is severe neglect. That is also preventable, and we know how to do that. We know that we need to reach out to our families when they're first getting started, even before that first child is born, to give prospective and new parents the tools they need to provide the support that those children are going to need. And you're right, it's incumbent on all of us, not just from a moral standpoint, but also just for the future of our county. And so thank you for all that you do for helping raise awareness, and a special shout out to all of our CPS workers. Yes, especially this last year during COVID, your requirement was still get into those households as much as you could, and you put yourself at risk, and we are grateful for that. So thank you to everyone.
And in conclusion, I'm sorry, please.
No, I was just saying thank you to her comment.
Yep. In conclusion, as we said here, that we know that we're giving you recognition, it's a proclaimed month, but we know this is 365 days of the year, 24 hours a day. We know that you guys are on call. We know that our Director Miller and the entire team and staff has this as a top priority, as does Child Abuse Prevention Council. To be proactive, not reactive, in every capacity that we can is to be admired and appreciated. The LISA project is outstanding. Perhaps we can arrange something where we're bringing this out in the community through the county and maybe raise some awareness. So let's have a follow-up conversation about that, because that's very meaningful and highly impacting. So we thank you. I do have a proclamation if you'd like to take a quick photo.
Oh, yes. Okay.
Through the chair, our next recognition of the Tracy Elks Lodge number 2031 will be postponed until the next meeting.
Thank you very much. Next on our agenda is public comment. Now is the time for public comment on matters within the jurisdiction of the Board of Supervisors that are not listed on the agenda, and any matters listed on the minutes, appointments, consent agenda, or closed session. Public comment is limited for now to 100 words or less and may be submitted by sending an email to sjcpubliccomments@sjgov.org. With regard to public comment, the law strictly limits the ability of board members to discuss matters not on the agenda, so this is not an appropriate time to have a discussion with board regarding your comments. We ask that you refrain from personal attacks during your comments. Comments from the public may not reflect the viewpoint of the Board of Supervisors. Madam Clerk, do we have public comments today?
Thank you, Chairman. We have one public comment that I'll read now, and we have several public comments for discussion items later on the agenda. So the one comment that we've received now is from an anonymous who writes, 100 words aren't nearly enough time for me to summarize my grievances. I need to remind the board last year they almost voted to close the clinic near Stribley Park. The main reason is that the facility has low capacity for the high demand. I hope the brand new facility under construction will have increased capacity. Squeezed unions to settle an unfair contract, the nurses went on strike. Financial reserves are exceeding expectations. County profited during COVID. Homelessness has increased. Do more proclamations and recognitions. Make Del Oso Farms a mass vaccination site where there's high skepticism. And Chairman Patty, that concludes our general public comments at this time.
Very well, thank you. Next on our agenda is approval of minutes. We've got regular meeting minutes of March 9th and March 23rd and special meeting minutes of March 26th. Barring any changes or amendments, do I have a motion and a second to approve?
So moved.
Second.
Please vote. Fantastic, 5-0. Next on our agenda, Vice Chair Wynn, you have appointments for the boards and commissions.
Thank you, Mr. Chair. I make the following recommendations in the form of a motion to Assessment Appeals Board number 2, one position. Third regular member position 1323, Reggie Kazakian. Economic Development Association, one position. Fifth Supervisory District Representative position 2605, Frank Farrell. Joaquin County Law Library Board of Trustees, two positions. First Trustee State Bar Member position 6902, Christine Kruger. Trustee Board of Supervisors Designee position 6901, Jeffrey Pragg. Again, I make these recommendations for a motion. Thank you, Mr. Chair.
Thank you. Do we have a second?
I'll second.
Please vote. Outstanding, 5-0. We move on. Next on our agenda is our COVID discussion and receive an update on the pandemic in San Joaquin County. And let's get a staff report, please. I believe Dr. Park is coming down.
Morning.
Good morning, Dr. Park.
So I'll start out again, as I've done before, with our EPI curve, and I bring this back just to show you a general look at the surges that we've had to date. And you can see again that we are right here. We've experienced a nice decline from our winter surge, as has the rest of California. We are experiencing anywhere between 50 to 100 cases a day still. And I would have liked this curve to really flatten out here, and it has not, unfortunately. It's a little bit higher than what it had been back in September and October before the winter surge. So still experiencing new cases every day, watching these numbers very closely because they haven't gone down to a nice low rate that we would have liked. Our hospitalizations reflect really our case rates. And again, you will see that after our winter surge, we have really experienced a nice decrease in our hospitalization rates. At this point, the blue line represents 58 people who are currently hospitalized for COVID, and the red line represents the fact that we have 19 people in our ICUs for COVID. 12 of those 19 people in our ICUs are on ventilators. 22% of our adult ICU beds are now occupied for COVID. Something that's interesting is that if you look at this dip right here back on March 25, we had come all the way down to having only 43 people total in our hospitals, and that was great. And this would have been nice if this had kept going downward. And for most parts of the state, this number has continually dropped, but we suffered an increase from 43 on March 25 to a week later on April 1 having as many as 64 people in the hospital. So within just a week, we had a huge increase, and the state did notice that and did inquire about what we were seeing in our hospitals. We did have a meeting with all of our 7 acute care hospitals and invited the CDPH to that meeting, and they did ask our CMOs and our CEOs of our hospitals for their input on any trends they were seeing in the hospitals because there was this concern. Of note, we didn't notice that there were any particular trends. Most of the hospitals reported similar stories in that they're seeing slight increases in their hospitalizations after experiencing many weeks of decreases. And it seems to us that it is a younger population now requiring hospitalization as compared to the elderly. And it's probably based on vaccination rates. And the state told us that that's pretty much mirrored across the state, that now older people are not being hospitalized as much as younger people. Fortunately, the people who are a little bit younger tend to make it out of the hospital a little bit better and don't stay for as long. And so from 64 people in the hospital on April 1, we are now down to 58. So this is something the state told us last week they would monitor, and we've been monitoring it closely, and it seems to be stabilizing. Again, it would be nice if that came down really nicely even further. So today we are moving to red tier, as has been expected. And I just wanted to show you these numbers one more time. And this time I've color-coded it to show you which numbers were in what color. And so these 3 bars are the ones that count: the adjusted case rate, the testing positivity county-wide, and the testing positivity in our health equity quartile. And you'll see that we were purple, orange, orange when we earned our first week towards red. And again, we're purple, orange, orange. And because of 2 weeks of having those 2 metrics in the orange, we get to advance based on accelerated progression rules. I want to point out that on 3 occasions, our case rate was 10 or below, and yet we adjusted higher than 10. And this is the column that counts. And that was based on the fact that we had not met the state testing median. So there have been 3 weeks where we made the case rate and did not meet the adjusted case rate of 10 because we were adjusted upward. You'll notice that the state testing median had fallen a bit and now it's climbing again. So that, again, counties are pivoting towards testing, just as we have been talking about the need to go back to doing more testing and focusing on that some more because we kind of started focusing on vaccinating. And now we need to pivot back to doing testing again. Other counties are saying the same thing. The same messaging is going around everywhere. And so the median again went up, and we again missed it by just a little. So it's great news. Obviously, I'm very happy that we're at red. I'm very happy for our businesses that have been waiting and for all the activities that people have been wanting to do. There's lots more you can do when you're in the red compared to the purple. But we do have to think about avoiding going back to purple, and I really think the next step is to think about going to orange. You will notice today that many of the counties that are in red are going to be going to orange, and the expectation is that later today the state will meet the 4 million vaccination goal, and once we do, there will be even more counties that will move to orange tomorrow because they will have a look back at their 2 weeks of metrics, and if they had qualifying metrics based on the 4 million goal, they will also move to orange. So we'll see a state full of orange, and we will be in red. And so our goal needs to get to orange as well. I do have here the conditions for which we would have to return to purple. And this is for counties that advanced based on this accelerated progression. Normally, if we had advanced based on having all of our metrics in the red, if we moved back to purple metrics, we would go back to purple after 2 weeks. We advanced based on having our case rate still in the purple, but our testing positivities both in the orange. And so for us, we would have to move back based on these conditions, and I'll just highlight. It's this first line here for counties that accelerated purple to red. The case rate, if it increases to more than 15% for 2 weeks, we move back, or if we move back to having a county testing positivity rate that goes back to from orange to red. So the top 2 lines of each of those pieces of this metric or this rule. The testing positivity in your healthy places quartile does not get counted against you when it comes to returning to purple. So I just want to let everyone know that this is a real possibility. It's not that hard to have your case rate go up by 15%. We're talking a case rate of 10 going up by 15%, back up to 11.5 where we were just a couple of weeks ago. And so I think people need to understand that we have to keep driving that case rate down. And the way that we keep that case rate down is by having people be well. People are well when they stay home and when they're sick and stop transmitting the disease, and people will become well if they would get vaccinated. So we're a huge push for vaccinations as usual, and if people could get that vaccine when it's their turn, we highly recommend it. It would actually help our case rate. I wanted to show you what the state's numbers are and how we compare. So apologize for all these numbers, but really just want you to focus on the fact that the statewide case rate is 5.0. And so that's reflected here. It's 5.0 for the state on this blue line. And ours being at 10, we have double the state median or average. The statewide testing positivity is 1.6%. It's been below 2 for quite some time. And ours being at 4 is actually more than double of that as well, at a 4% testing positivity countywide. Numbers seem to be worse in the Central Valley, and so that's been something that's been going on since the beginning of the pandemic, is that we seem to suffer more in this region. And so this is another thing that the state is looking at, is our case rate and our positivity rates, and are they trending downward or not? And we seem to be stubbornly staying right around 10 for the past several weeks. At least it's not getting much worse or climbing upwards. And so I would say that we're stable, but unfortunately not doing as well as the rest of the state. And that's just that same bar graph, sorry. Have that in there twice. So what could be holding us back? There are several reasons. Part of it is that we're a really unique county. We're large. We've got some rural, but we're also very urbanized now. We're abutted by a lot of urban counties. We travel to urban counties. We have a huge essential workforce that have never stopped working throughout this pandemic. Perhaps we even have less longevity in our healthy places indexes where we know people don't live as long. And so that might have led to us getting less vaccine, as you know that the vaccine framework and the math was used around how many people you have 65 and older. So many reasons for why I think us as a county, we haven't moved as fast as others. We also have some degree of noncompliance and complacency amongst our residents, and I wish that we could stir up some more interest in all of the masking and the distancing and the things that people might be letting go of. And then another reason that might be affecting us is variance. And so this column here shows how many variants we've seen in the state. And then what we've done is we've just added how many variants we've detected so far in San Joaquin County. These are just variants of concern. Obviously, viruses mutate all the time, and there have been many different mutations of the original wild type COVID-19 virus. But these are the ones that are considered variants of concern. Other variants are called variants of interest, or VOIs. VOCs, variants of concern, are those that the CDC has determined are concerning because they do cause increased transmissibility and perhaps increased severity of disease, and perhaps vaccines are less efficacious against them. So that B117 is the UK variant, and this is the big one going across the nation. We have more of the last two in the state because of those are the California variants, the 1427 and the 1429. However, nationwide, what the big concern is this UK B117, and we're hearing reports from other parts of the country, the Northeast and the Midwest, with high rates of B117 causing perhaps a fourth wave. And so the state's really looking carefully at our numbers because obviously as a state we don't want to be going through a fourth wave here. We do have 9 confirmed cases of B117 in our county, one of them in a minor, and that's a concern because in some parts of the country it seems to there's a lot of reporting that children are transmitting this and are getting more ill because of the 117. The California variant, so B1351 is the South African. Thank goodness we don't have any of that. And the P1 is the Brazil. Those are in the state now, but not in our county. I did say, I think last time that we had a P1, but that was a false alarm. It turned out to be a P2, which is a VOI, not a VOC. The two that are from California, they're very interesting. They've been named now VOCs. They were VOIs before, but they've now been shown to have increased transmissibility as well. And so one of the reasons why rates might be going up locally, don't know. Obviously, these numbers that we're showing for the county are much less than what we must have in reality because not everyone's test gets tested with whole genome sequencing. There's just a small sampling that goes on to whole genome sequencing. So who knows how many variants we really have in reality here in the county. Could it be that the California variants are somehow suppressing the B117 in this state, and that's why we're not experiencing increasing numbers, and that's why the state has such great case rates and such a low positivity rate overall? It's possible that because we have these other variants, that is happening, some suppression of the UK. We just don't know yet, and all of this stuff is being studied right now. What's fortunate about the UK variant or B117 is that our vaccines that we have been shown to be mostly effective against it, and that's why you'll hear that we are in a race about vaccines versus variants. We really feel that the vaccines we have are effective against the UK variant, and so it really is a race to vaccinate before this variant takes a huge hold in our state, as it has in other states. So the newest updates from the state that become effective on April 15th. So April 15th is a big day because, as you know, that's the day that 16 and over can all be vaccinated. So anybody who is of the age for which the manufacturers have these vaccines approved can get the vaccine. But also some new things came about, such as gatherings guidance, new guidance for private events or meetings, and indoor seated live events or performances. I have been telling our schools and our young folks that this really matters to them because when it comes to proms and dances, the state's saying that that's under private events or meetings, such as weddings. Proms, those are all under private events. And I've only listed here what we're allowed to do now that we're in the red tier, but this obviously gets larger and your capacity increases if we were to move to orange. Graduation ceremonies would fall under indoor seated live events. And so again, if we were to move from red to orange, our capacity at our graduation ceremonies could then be increased as well. So again, our way out of all of this is the vaccines, and we're really trying to continually push people to get vaccinated if they're at all hesitant. So lots of messaging being worked on. We do have that county commercial that was developed for TV, and we have radio ads in Spanish and so on and so forth that you might see or hear in the coming days. If you look at our dashboard, 195,915 residents have been vaccinated. That's the total for partial and fully. About 112,000 of those folks are fully vaccinated, and the rest have had at least one vaccine. And so if you really look at the numbers, we're talking about almost 200,000 folks who have been vaccinated or are about to be fully vaccinated. That's a great number if you think about it. I asked our EPIs to tell me how many people we have in the county who are over 18. So for adults, we have 539,000 people over 18 in the county. The rest of the 782,000 are kids and are not even eligible. So if you take that number, we've really vaccinated about 35% of our adults 18 and over. And if you use the number for 16 and over, we've done a pretty good job too. And I think that's going to get even better when the mandate changes and 16-year-olds can be vaccinated. This is just a calendar that OES works on and is constantly updating with all of the events going on. And just a quick view, just to show you that on any given day, there could be as many as 4 vaccine events going on in the county. But you could really, anyone looking for a publicly facing open event and not one at a farm or a company per se should go on sjready.org. That's still the best place to go. And the Ag Center events and the Delta College events are definitely open to the public and are currently posted on sjready.org. This is the event starting tomorrow at Stockton Arena. This is going to be huge. This is Kaiser's mega or mass vaccine hub, able to accomplish 5,000 or more vaccines per day. This was obviously something that was supposed to open last week and got put on hold. We did a lot of lobbying to the state, talked with some of our politicians and said, please get this started. I wrote letters on behalf of this. And thankfully, they were supplied with vaccines and are starting literally tomorrow. And anyone who's interested in a vaccine through this venue can get on the myturn.ca.gov website. In addition to Kaiser's Stockton Arena, there's other folks who are now on MyTurn, so that's another way to get vaccine. This, my understanding is will be supplied with the Johnson & Johnson brand. So huge. And I really would like our residents to go get vaccinated wherever they can find a vaccine. Our Delta College and Ag Center events are being supplied with Pfizer. This is an event. This is going to be ongoing for some time. And this Mass Vax Hub is not only open to our residents, but residents to other counties. And so I would really impress upon our residents to take advantage of the fact that it was selected to be here in Stockton, and take advantage of the fact that it's close by, really targeting ourselves in the Central Valley, but open to others. So please make sure you grab these appointments before people from other counties really come in and take them all. That's my fear. We need to get people into these vaccine events as much as possible. Just wanted to say that you might have heard the news coming out of the CDC last week, about a week ago, that the mRNA vaccines, both Pfizer and Moderna, were 90% effective. This is great news. We had heard they were 94 and 95% in their trials, but to hear that they were 90% effective in real life was huge. It's a huge win to say that we've actually been following people who are healthcare workers, first responders, essential workers, who got the vaccine, and in real life situations, it was 90% effective in them. So it was fantastic news. And I want to end on a great note here. This is my last slide, and I saved the best for last because this really shows and validates the work that we've been doing in the county. And to explain this to you, any county that's got their bar going to the left is a county that has been doing more work vaccinating their Healthy Places Index quartile 1. So if you look at the words here, it says negative values mean that your vaccine equity metric for quartile 1 has shown higher coverage. If you're up here to the right, it means that you're covering more of your quartile 4, the richer people who already have better access to transportation and medical care. These folks are the one. This is the way you want your bar to go. And we were third when the state showed this to me last week. So I'm very proud that we're a bar to the left, and that we're one of the best counties when it comes to vaccinating our Healthy Places Index quartile 1. This really validates all the work that we did early on to pick those zip codes and to vaccinate in those census tracts even before the state asked us to. That's where we were placing our vaccine events, and those were the folks we were trying to invite and appeal to. So it's great news, and the state's creating this as a shared, it will be a shared site now that I'll have access to, and they'll continually update these numbers. Was very excited to share that with you. So thank you.
That's great news, Dr. Park, especially that last slide, the effort, the partnership with Bayesian, that was very progressive, and that was a tool that you brought in to this county that was unknown, and it was you were looking to utilize that asset, and it proved to be very effective, and I know that it's a continued effort. Before we move on to any questions from other board members, since we do have a fear and a concern of going back into purple, and we want to go more towards how quickly we can get to yellow, what exact actions and measures do we need to be proactive to accomplish forward momentum and extremely quick forward momentum? We don't want to plod along. We want to go leaps and bounds. What do we need to do in order to accomplish that? And what are we doing? Just like when we brought in Bayesian to be proactive, what are we doing or what do we need to do to move forward in leaps and bounds?
Yeah, thank you. There are a couple of things we need to do, and that is to do more testing. And people get upset when they hear that because they're tired of testing, but we have to continue to push for testing. And the reason for that is the reason why the state pushes us to test is a good one. We need to test in order to really know, are you asymptomatic and you're a carrier? Can you please find out and stay home? This is the whole reason behind doing testing on a regular basis on most people in the county, is because we want to find out where this disease is hiding and ask people to isolate. But of course, for reasons of moving through the tier system and the metrics, it also is an advantage to us. And one of the reasons why the state has posed this to be one of the metrics is to, obviously motivate us to do more testing. If we could test more, we would hit that state median and we wouldn't have suffered that coefficient those few times that we did, and we're always on that verge and tipping. And again, that 15 percentile is not that hard to get to, so we need to keep those numbers as low as we can. And by testing more, sure, we'll find more, and maybe our case rate will go up a little bit, but if we could test massively, we could really overcome that coefficient.
So what actions will we take? I know that we've co-located testing with vaccination. I'm uncertain how that's going and how engaged we are in getting people to do a test while waiting, especially the 15-minute post-vaccination waiting time. But what actions are we taking to, again, we don't want to fall behind because we didn't test enough. Exactly what actions are we taking? Do we have planned, or do we need to take?
Sure. So we have asked the private vendor HR Support to go ahead and test at their vaccination sites. And they did start that, I believe, on March 27th. So as they vaccinate, they're offering testing. So it kind of had like a captive audience there, and we're taking that to our advantage and trying to offer them tests. So that's a co-location. The other entity that has the ability to test and vaccinate would be Joan Sing Song and her mobile team from San Joaquin County Clinics. You might know that she had been really a force with testing back in the summertime and even in the fall when she went to our plants and our farms with outbreaks at our homeless shelter and did weekly testing to help us get through some outbreaks. And then she also offered general testing even to asymptomatic people. We've asked that team to start that effort again. They have been vaccinating. So it does take more bodies to try to do both, but they're going to make that effort. She's going to be doing a testing event at the homeless shelter and also at a packing plant. And perhaps she'll be back at Lincoln Center doing testing the way we had done back when we tried to get to red and we did a big push with the restaurants. So she's setting up more testing events. And hopefully it'll get us over that median. And the other thing we need to do is vaccinate.
Understood. The vaccination's going. We're moving forward. Great numbers, 200,000 plus, close to it, and that represents that 35% of 18 and over. So it sounds like you've got a strike team in addition to whatever's going on at the vaccination locations, and I'm uncertain what the numbers are. Are we getting an extra 100, 200, 1,000 tests a day by co-locating? I'm uncertain. I don't know if you have that information yet, since we just started about a week ago or more. But if we have, do I understand correctly, have one strike team that was proactive last summer that you're reactivating? And if we have one, what's it take to get 3 strike teams daily out engaging and getting those numbers? These are critical accomplishments that we need to make. We don't want to slowly go from purple to red and then slowly get into orange and then maybe eventually get to yellow. We want leaps and bounds. The people are screaming for it. Businesses are dependent on it. Our economy needs it. We are the children, sports, activities, schools, you name it. Everybody wants this. I need to know, and I think this board would like to know, what more do you need that we can make this happen faster and more with more effort?
Certainly. So it would be great if we had 3 teams out there, but we would need.
So how do we accomplish that? What do you need?
We would need the medical team. We would need more medical teams.
Okay. So then mobilizing assets that we have through the OES department. I know that we were able to mobilize and do things for mass vaccination. We ramped up to our almost capabilities of doing almost 40,000 vaccinations a day. Have you utilized that asset and the mobilization from the fire department to whatever our medical providers could be? Have we delved into and mobilized those assets to get 3 strike teams?
No, Chair Patty, I don't believe that we've looked into all of those options at this point yet. No, we were looking to see what kind of numbers we could get from the 2 entities. We already have testing sites all over the county. We need to get people to them. We need people to go to them, and that's another angle too. Is how do we motivate people to get to those test sites that already exist? We have them at Stockton Unified Schools. We have them in community centers. If you go to SJ Ready, you could look up testing, and those sites are still there. The Lodi Library and the San Joaquin General Hospital parking lot still have OptumServe. They're there. Then they need more business. They're not testing as much as they're capable of doing, and that's a fact. How do we get people there is the problem. When they're not feeling sick and they have to take time out of their personal lives, or maybe they have to make an appointment to get there, what can you do to motivate them to go? And so that's really what we need, because the test sites are there.
And it's a tremendous challenge. I mean, when you've got 35% of your population that might be consider themselves at risk and want to stay healthy, getting the vaccination, I believe the old measurement before the vaccinations went into motion, the old measurement was testing, and I don't believe they've amended that since we've got 35% of our population now inoculated. Is there any conversation in Sacramento to make changes so that we don't digress, but in fact we progress much faster and get to what eventually I'd imagine would be an identified green tier? So where are we at with that? Because this is a challenge, and I understand it. I know we have one little public service announcement for vaccinations. Do we need more? What can we do, and what assets do we need to mobilize for you and with you?
Mm-hmm. Unfortunately, the state's not going to change the blueprint metrics and the way that these medians are used and the 3 metrics that are used. But yes, at some point, all of that will go away when the state as a whole feels that we've accomplished enough vaccinating. And I don't believe they're going to be calling it a green tier. They're saying that for now it's being called Beyond the Blueprint. I don't know if that name will stick, but Beyond the Blueprint means the blueprint will retire. Not now, but maybe in a few months. They're talking about giving at least 8 weeks after the time that 16-year-olds and above can be vaccinated. So perhaps mid-June. No guarantees, because we really need to see people take that vaccine. We need to see people want it and take it, and if we can get to a certain percentage of people who have been vaccinated, we will retire that blueprint. But for now, for the next couple of months at least, we need to keep working towards getting to that state median, and we need to keep testing. There's no other choice at this point but to stay within those parameters and try to achieve those goals.
Okay, what plan of action do you need, or do you need to work with somebody to create a plan of action to get more of a strike team out there, 3 of them mobilized? If we've got schools open, libraries open, people aren't going in, how do we utilize those assets from being stationary to being mobile, as you demonstrated the one person had done effectively last summer? Right. So again, we need to be proactive, not reactive. So to help you, what do we need?
Right. So I actually have a meeting this afternoon with our Assistant County Administrator, Matthew Pollan, to discuss this very topic about testing. We have been meeting with San Joaquin General Hospital, and we will be meeting again today to discuss some options to increase testing. So we will perhaps come back to this board or to our county administrator, Mr. Wilberding, with some further recommendations.
And at least inform us what you find, so you can send an email to the supervisor so we know what's planned. We can share any plans of action and promote it and support it. So I appreciate the questions. And these are difficult challenges, I know. I just want to make sure that you're mobilizing assets, and whatever you need, we are engaged and able to provide. Thank you. I've got a question here from one request to speak from Supervisor Rickman.
Thank you, Chair. And thank you, Dr. Park. How was your vacation?
Oh, it was great. I had a few days off last week, and it was nice.
Good. Well,
Continued to look at emails. I couldn't help myself, but at least I was home.
Well, hey, you deserve it. Thank you very much. And again, thank you for, the hard work you're doing. And as I mentioned before, some of the questions that I'm going to ask, that we ask, and it seems like it's focused at you, but we know that you're just following the chain of command in which the state dictates to the county what we have to do. And unfortunately, it seems like you get the brunt of the pressure on it while they're safe up in their ivory castle in Sacramento, while they dictate these orders that we have to follow. So I just want to make that very clear. So thank you and your team for all that you have and continue to do. Now, one of the concerns I have, and it was mentioned in here as we go into the red tier, was it indoor activities that you have to show proof of vaccination? First of all, how is that not a privacy issue like a HIPAA? And I know even like the ACLU has had concerns with like an equity issue. So I hope we're not mandating that.
Yeah, that was an interesting caveat that the state created for some of these events. So you will see, and I don't have it in front of me, but you'll see that when you go to purple, from red to orange, a lot of those things have capacity 25 or 50, but it increases if everyone is vaccinated or has a negative test. Interesting question about the HIPAA. I don't know if that's been raised to the state or how they would manage that.
I mean, I think it's a huge issue, and it was something that I was going to address, and I think I'll address at the end of our session today, something to bring back to this board. But it just shows a huge concern, and it just raises tons of different alarms. A couple more things. I know we're having a mass vaccination site here in Stockton. We have any other plans for any further ones, like possibly like South County? I know our caller today mentioned Delos Farms. We have the Sikh Temple. We have, the mall parking lot. We have a bunch of different areas. Is that just, we're just waiting on vaccines?
So thank you for that question, because now that Kaiser's at the Stockton Arena, we have raised that question as to the Ag Center and Delta College all being in Stockton. Do we now need to move them to a different site? Interestingly, they offer different vaccines, and some people might still want a vaccine that's offered at Delta College or Ag Center as opposed to the one being offered at the arena. But could we then at least move one of them to another site? And really that would be an issue of finding the site, and I don't know if OES is in talks with anybody in the South County for such a move. It's not so easy to find a constant site that would be available.
I can tell you we have a site. I can get on the phone right now and get a site for it. But, I mean, you look at South County, we have if you look at the cities, we have Mountain House, Manteca, Tracy, Ripon, Lathrop. That's over 200,000 people that we could.
And that's great to hear. And if you want to talk with me offline and talk with OES, I would love to hear what site you're talking about.
Okay.
It's definitely not off the books. It's something we've been discussing. And for this week, we already had the Delta College and the Ag Center events lined up, but we can move them. Now, the Ag Center has become a great site for our farm labor contractors. They have really come to become familiar with that. Every day, about 100, 150 slots are reserved for them, and it's working out great for them. But HR support, so the Ag Center is manned by our San Joaquin County Clinics team. Our HR support vendor is manning the Delta College, and we could certainly move them to another site. So I would love to entertain that idea.
All right, great. And this is something else we've spoken about, youth sports. tournaments in particular. Can we have, if we're moving in the red tier, are we being more restrictive locally, as a county than the state when we're allowing, when we're talking about tournaments, like youth sports tournaments?
So far, no, I don't believe that I've been more restrictive than the state. I haven't written any order locally that is more restrictive than the state, so we're following state guidelines. The state guidelines do say that if you were to have a tournament or a multi-team event with more than 2 teams competing, that they are supposed to ask their local public health department for permission. Sometimes people do ask for that permission, and sometimes they don't, and they go ahead and have their event without ever contacting us. But for those that have asked for permission, I have been granting approvals.
All right, great, thank you. And, and just like we had this presentation earlier, and the negative effects that's happening to our kids. We talked about suicides here in San Joaquin County, and I think a lot of those are preventable. And, depression, school dropout, and the list can go on and on. And so it's, we just focus, I think, on one thing, the COVID, but we don't look at all these other negative things that are happening. So thank you with that. When we talk about this lockdown, can you explain, you've seen other states open up and eliminate some of the restrictions. It's still following safe practices, and their case rates have gone down. There hasn't been this huge surge that people are talking about. For example, I think it was Texas. After 2 weeks, once they lifted the restrictions, there wasn't a huge surge. Can you explain why that is?
To be honest, I haven't been following what's going on in Texas. I do know that they lifted some restrictions there, but I have not been following their case rates. I would say that still from a public health standpoint, we would not recommend that we just suddenly abandon all of the simple measures that we've grown used to using to combat this. So masking and washing our hands and distancing. I believe in Texas they don't have to mask now, but they can choose to. But I think that's kind of a dangerous line to be walking because we know that masking works. The whole reason why the CDC said that kids don't have to be 6 feet apart in schools now and that it can be 3 feet is because studies were done where the masking made the difference. As long as everybody wore their masks, it really showed that 3 feet was just as good as 6 feet. So I think that things like masking we cannot abandon. I don't know about the case rate in other states, but I do know that there are multiple states experiencing what looks like the beginning of 4th waves or some uptick in cases, perhaps because of the variants and perhaps in part because of the relaxation of some of these rules.
Even like Supervisor Nguyen mentioned in a few board meetings ago, comparing Florida with California, 2 extremes. One, locking down everything in California, Florida not, and look at the population density, which is similar, and the results are similar. That's something, I guess it goes beyond what we can do here. And I know for me, talking about the data and science, showing the data and science. And we've asked, and just to let everybody know, we've asked the state, we did a Public Records Act request asking the state for the data and science behind a lot of these things. And we were denied the information. So, it's kind of hard sometimes to make policy decisions when you don't have all the information available. If the information is there, why they wouldn't release it is beyond me. And another thing I think the chair mentioned, I know you talked to the state about changing the metrics, about getting the negative tests, and they're not going to budge, correct, on that. And just want to give a shout out to our Assembly member, Carlos Villapudua. I know he has talked to you, and I've talked to him on a weekly basis. I know he's pushing the governor's office for more vaccines for San Joaquin County. So I want to thank him here publicly for fighting for us here in San Joaquin County. And two more questions. You talk about, masks and so on, and those folks that have been vaccinated, and we've touched on this at the last board meeting. To me, if you're vaccinated, why do you still have to wear a mask? There isn't, at least the science that I've looked at, the data and science, you have the immunity to it, and there's no data that says you're going to, at least that I've seen, that you're going to transmit it. And you're saying, and the last time there was one case, possibly another case, so two cases out of, 250,000 or so, the 35% of the adults that have got the virus again. So why would there be a mandate for folks that have been vaccinated to still wear a mask?
Sure. So as I said, the mRNA vaccines have been shown to be 90% effective. That means that in 10 in 100 people it was not effective. And so that's the issue, is for which person who's fully vaccinated did the vaccine not take? And can that person still be infected with the virus and then be a transmitter, although asymptomatic or mildly symptomatic and not really thinking that they could have COVID? And that's why we would say these vaccines have been proven to decrease severity of disease, but we don't know if they're actually as effective in decreasing the transmission rates. And it's being studied still. And since we don't know what that 10% of people could do, we ask that people continue to mask. Now, the CDC does say that fully vaccinated people have some allowances now, because we realize that we're telling people vaccine is the way out of this pandemic. We need to get vaccinated, and that's how we'll end up maybe a year from now at a baseball game and we can all take our masks off. But we're just not there yet. We need to get more people vaccinated, more than 30% vaccinated, before we can feel that we've got enough immunity that even those 10% who are not protected won't get the virus from somebody else because everybody else is also vaccinated. So that's the problem, and we don't have enough of that immunity yet to feel comfortable saying that we can do that.
But what about the folks that have caught it already, the COVID-19? They have natural immunity to that. So is that even being put into the equations? If we have 35%, and do you know the numbers of people that percentage-wise that have caught the virus and have natural antibodies stored?
Well, yeah, we've obviously had millions of people who've caught the virus. The immunity might last about 90 days for them, and it might not last as long as the vaccine, and it might not have given them as strong of immunity as the vaccine itself, which is why people who have had COVID are still advised to get the vaccine, because the vaccines, when they're studied, seem to create an immune response about as strong as someone who's had a severe illness. But for people who have suffered mild COVID illness, their immunity is probably not as strong as getting the vaccine, and we don't know if the immunity really has a strong, long duration. So yes, those numbers are accounted for. When you hear the CDC or the CDPH say that we'd like to get to 70% of people vaccinated before we get to beyond the blueprint, that 70% accounts for the fact that there's another small percentage of people who will have natural immunity on top of that.
How long will the vaccine last?
So studies are still going on about that, and it's very hopeful that it could last 9, 12, 15 months, and we don't know exactly for each vaccine yet, but we believe it to be more than the 90 days of natural immunity. And
see, I've heard with at least what I've read out there and folks that I've talked to, those that have caught the virus naturally, I've heard, it's been all over the map. Like you're saying 60 days. I heard 8 months, 9 months. I heard, folks that have, caught there was one lady, I was listening, I forget who it was from, and of course she's an elderly lady, caught the Spanish flu back in the day, and she still has the T cells or antibodies, toward that. And so I just think it's, the burden of proof should be on the government when you start taking, liberties away. And it just seems, like you said, we don't know, so there's no science behind it. It's just I guess, well, it possibly could be this way. So meanwhile, you can't sing in church and stuff like that, which, it sounds kind of ridiculous. And the last thing is, we've had the flu vaccine for more than, 80 years. And, we still have the flu. And now you're listening about the variants. So if variants are the standard by which these mandates are going to stay in place, it seems like they're going to be here. These mandates are going to be here forever. And that's another concern on my part. And I'm sorry, Chair, I promise you this is the last question. How many vaccines did we get this week?
16,000.
16,000. All right. Thank you, Dr. Park. I appreciate what you do. And Chair, I'm going to yield my time back to you, sir.
Absolutely. Next up, I have Vice Chair Wynn.
Thank you, Mr. Chair. A couple of questions along the lines of Supervisor Rickman. There's been discussions amongst the medical community in regards to those who've been infected and have that immunity, supposedly, and the question arises is, should they receive the vaccine itself, because it's kind of like, one, possibly unnecessary, two, possibly unhealthy. And I understand that there's a lot of discussion on this issue. I'm just saying that there is no one side or one position. There's a lot of discussion on this. And Supervisor Rickman's right, because eventually, tests or studies will prove one way or the other, all the stuff that we've just talked about this morning as to the length of immunity, the effectiveness, all these things. So these are things that'll evolve. A couple of things in regards to, and I don't see anybody from OES here, but I just asked a question. The second dose is becoming problematic from the standpoint that people who have gotten the first dose, for example, one individual developed shingles, wasn't able to make their appointment. Trying to get a second dose is really a challenge, especially trying to find the specific vaccine that they were originally given. And apparently my turn is not, they're only concerned with the first dose. So what's the alternative or the solution for individuals, for whatever reason, either, and I know there's been some concern, especially as to the lack of notification on a time or date, for the second dose. Are we working on that? And I guess my question, because I've been to several of the sites, and some of them make the appointment there before they leave, so people can rest assured that they have a date and time to follow up. How are we doing on that for people who, for whatever reason, either haven't been notified or two, for unforeseen problems, missed their appointment?
Right. So we're doing, thousands of vaccines a week, and for the most part, it does run smoothly. But I have been concerned about people complaining that the second dose appointment wasn't made, or they weren't able to make it smoothly. So it's obviously something that we have to continue to work on. When it comes to the My Turn system, it's really not under our control, and many different counties have made complaints to the state about the system failing in one way or another. And I know that the state is continually working on that as well. But we have heard that there have been some mishaps in some of the My Turn events and the state-sponsored vaccine sites. When it comes to our own vaccine sites that the county is running, ideally you would walk away from your first dose knowing when you're supposed to come back for your second dose. Most people have at least the date in mind, and they know that, perhaps not a specific time or time slot. But we do work through all of those, and we field all of those questions as they come. I think that it's really a work in progress, but it's been actually, if you look at the totality of people being vaccinated, it's not so many that have had a problem with the system.
Well, I appreciate that. I guess the question is, would 211 be an option for them to call in these situations? Would they have some information as to availability? Because there's nothing on our website, so to speak, that would give them that opportunity to make an appointment for a second dose. So is that a possible solution?
So my understanding is that OES will often engage 211 for particular events and say, here's the list of people, and when they call, please assist them. But it's not that 211 is aware of every event going on in the county and knows how to assist every person who calls in. But OES might assign them to take care of certain groups of people, and those groups of people are told to call 211. But in general, if someone were to call 211, they might not always know how to help you based on the event. So 211 might be able to help, and OES might be able to help, and public health might be able to help. So usually we end up hearing about someone who's having some difficulty, and one of us ends up assisting. But as I said, it's not like it's hundreds of people who are reaching out to us every week. It seems to be a few.
Well, you're right, and in the overall, obviously the vast majority are going through the process rather smoothly. But it doesn't matter how many thousands that are going through smoothly. It's that one, and it would be either you or me. I mean, I'm not concerned about necessarily the other 200,000,
right? Because
I need my second shot. So again, thank you. I think I appreciate the comments in regards to the health quartile, and I think you're right. I think because we set up a system which was dual with the healthy places and also the Bayesian, we were able to really drill in and focus on those areas that need to be tested. So I think that's one of the reasons we've done so well on that. And unfortunately, we weren't able to continue. Otherwise, I think we would continue to be, I want to say on the bottom, but really on the top in regards to that particular. There's also, and I was on a call yesterday, and there's again a question in regards to this My Turn. Sending people from out of county into San Joaquin County for their vaccinations, and the state representative said supposedly they're working on that. Are you aware of any information as to when that particular fix will be in place?
Yes, so it's called geofencing, meaning we can geographically fence in our vaccine events and say that we only want this vaccine event opened to residents of the county. And other counties can do the same and prevent our county residents from going to their counties for vaccines. Geofencing will be allowed for some of the smaller county-run types of events where we might be at a church or a farm, and we put it in My Turn, but it's geofenced. It's not going to be allowed for the big things like the Kaiser Mass Vac site, and it's not allowed for the pharmacies that are being supplied through the TPA or through the federal government. So your CVS's, your Walgreens, your Rite Aids, they won't be able to geofence. But starting sometime around April 9, anyone who has events in My Turn that wants to geofence and who is allowed to geofence can set up their clinic as a fenced-in clinic. And so we might be utilizing that feature to do that. Originally, we were told that the feature will start on April 9th on the My Turn system as an available option. I heard later that it might be more like mid-April before we can start to geofence. Okay.
And also, Chair Patty was talking about the strike teams. I understand that there's now a strike team that goes out for those who are bedridden or can't go to a site for vaccination. Is that, how is that working? And I assume it's up and running, so.
Yes, we do have at Public Health a small strike team of nurses. We have 3 nurses that have been able to travel to certain, for example, skilled nursing facilities where one resident might not have been in the facility when CVS or Walgreens came to vaccinate and they missed that opportunity, or one new employee at a long-term care facility, and homebound patients. So we are working with the Regional Center, Valley Mountain Regional Center, and IHSS to gather names of people who are homebound, because we are willing to use that strike team to go into those homes to vaccinate people. And what we're using is the Johnson & Johnson vaccine for that, so it's a one and done. So we do have that availability, and people can contact us at our SJC_IZ at sjcphs.org website if they have a person in mind.
Okay. And you'd mentioned in the beginning of your presentation in regards to a surge, especially in the younger age population. So going back to our contact tracing, or whatever we're doing in regards to identifying locations or activities that are generating these increases, where do we stand on that? What information do we have in regards to what the public should be aware of as to not participate either by location or by activity?
So, yes, our contact tracing team is continually finding, people who have said they've been to a gathering or they admit that they've got it probably at work. But it's really everywhere. We have had some, recent outbreaks, but I wouldn't say that just because we find the outbreak that I would tell you not to go to that place, because some of them are schools, and we wouldn't say don't go to school because we're expecting that to happen. We're expecting to find outbreaks the more we congregate. So, yes, we've had an outbreak now in a restaurant recently, in a grocery store, and schools. Those are the recent ones that we've had.
And that was verified by the number of individuals who were identified to have participated in those locations?
Yes, an outbreak is defined as 3 or more individuals who have been in that same location in the 14-day period.
Okay.
They had positive tests, yeah.
Okay. In the beginning of this, back in March of last year, the only concern really that was expressed is we wanted to make sure we didn't overwhelm our healthcare facilities, flatten the curve, and that was the I guess the call for all of us to participate in making sure that we didn't spread the disease and those types of things. That seemed to got lost somewhere along the way, because if we look at our numbers of hospitalizations, whether it be in ICU or hospital beds, we're way down. And the other thing is that when we talk about numbers, we always talk about licensed, beds, when in fact, especially when we were like at 140% of capacity on ICU, et cetera, there's obviously a lot more beds out there that are medically approved and maybe not licensed, so to speak. So I guess my question is, it would seem to me that hospitalizations, whether it be in the ICU and the ventilators you talked about, or just be in a hospital bed being cared for, that would be really the one metric that we would be most concerned about, because that was from the very beginning the main concern about overloading our healthcare system. And now we've gone way beyond that, and it seems like, especially in this state, and going to Supervisor Rigman's comments, one, when Texas opened up their state, every day their numbers went down. And you're right, it's voluntary on the mask, and I understand the mask protocol, so to speak, and people don't know if that person's been vaccinated. I understand all the ramifications of that. But on the other side of it, you've got the state of Florida, which has been open since, like, school is probably back in the fall, in the late summer of last year. And their numbers, albeit they're a little bit higher than California, except I think for the youth, I want to say numbers as far as the percentage, but in spite of California, and I'm not blaming you, I understand, but in spite of California's probably one, in addition to New York and possibly Delaware, being the most restrictive in Michigan, in the country, we still had a spike. I mean, we still went through the roof, way beyond the summer increase, and we were doing all the things that we were told to do. And so my concern is that as we continue down this path, no matter what we do, and I believe that people are responsible and they do what they have to do to protect themselves. But I would also say, as has been commented before, is that there is a COVID fatigue to a point where, some people are just questioning why, when they look at other comparisons of a similar spike or whatever. So my question to you is simply, in your role in communication with other public health officers around the state, does anybody ever raise the issue about why we're doing so much to restrict our public activities, whereas other states are not? And yet, we're not doing great. In fact, we're just about even with everybody else. And as we saw in our presentation on the children abuse this morning, there are ramifications, especially for our lower income families, especially in the area of education and on jobs, not being able to go to work, and on and on. And I'm even aware of an individual who has not worked because of the unemployment benefits, which were more than what they were making. And I talked to business owners who have a hard time finding employees because they're making more money from the government than they are on the job. And I know that's not your area, but my point is it seems to me that we're doing a lot of things in this state that are counterproductive to our overall welfare and quality of life. And my question to you is simply, do you, and I know you have a lot of conversations with a lot of your peers and obviously, does anybody ever talk about those things?
Actually, Supervisor Wynn, it's quite the opposite. In my calls, we don't have health officers complaining that other states are allowing things and why can't we? They're mostly concerned that we're going too fast. So it's quite the opposite. Just on this last call, there were several health officers saying, why is so much stuff going to be open on April 15th? Why everything on the same day? And now you're going to be talking, the governor's announcing today this beyond the blueprint. Why must you announce that there will be an end to the blueprint? People are going to think that it's now, that we're ending it now, and they're going to go hog wild. And so most health officers complain about the fatigue leading to complacency and non-compliance. And it's hard. It's hard because we know people are tired. And how do we motivate them to continue to wear their masks and wash their hands? And how do we tell them, please go get a vaccine, please go get tested? It's really hard, but I'm not hearing the opposite as much. People saying that we're going, that we should be opening up faster. It's actually concerned that we are going to lose our stronghold. We're doing so well compared to other states that are facing this fourth wave. And here we are at some of the best numbers we've had statewide as far as case rates and testing positivity. So let's try to maintain that hold that we have and not go too fast. Our strength lies in our safety and our purposeful slowness. And we've been successful with that, right? With this, I know we all had a winter surge, but since coming down from that surge, we've been able to hold on to the lower numbers. And so that's actually what I'm hearing in the calls that I'm on.
Okay, well, I appreciate that, but I guess my concern is that's not what I'm hearing. And, you know, I have to deal with my constituents as you deal with your peers. And it's unfortunate that they don't at least discuss that. I mean, they can dismiss it. I don't have a problem with that, but at least they should be aware of it. And if they're not, it's unfortunate. The last thing is on this particular presentation, could you send me a copy of those slides? I've got several emails I have to respond to after this meeting to give them, some city council members, some better information. But again, thank you.
Thank you. And Supervisor Villapudua.
Thank you, Chair. Dr. Parker, I just want to thank you for that presentation. I was wondering if you could tell me a status or how we're doing with vaccination with the ag workers.
Yes, so I wish I had specific numbers because this question has come back up before us. How many ag workers have we vaccinated? And it's just impossible to know exactly. But we've been doing so many different things with the ag workers that I know we're reaching them. It's just that we just have so many, and they continue to migrate into our county. So we're still working on it. You know, back when we had started on the teachers, we already had Joan going into our packing facilities and our farm. So she was doing individualized events where 6 or 7 companies would gather their 65 and over, and now she's doing any age. So we've got her out in the fields doing that. We have, as I said, the Ag Center reserving spaces, and they were there last Friday till 8 p.m. to make room for ag workers who needed to be vaccinated in the evening hours. So San Joaquin County Clinic stayed there for quite some time for the farm labor contractors. We have had several events at the Lodi Grape Festival where we do invite, first off, people from some of our farms that are on a list that was compiled for us by the Ag Commissioner. So we've been doing many, many events where we're inviting our food and ag. We're also reaching out to our restaurants and our grocery stores to let them know. And I know that some of our pharmacists like Safeway and Save Mart have taken care of some of their own grocery stores and are now helping other grocers. So we're getting there. It's just a long haul for that particular sector.
Okay, well, thank you. You're doing a great job, and thank you very much for your hard work.
Thank you, Supervisor Villapudua.
Next, I have a comment. Madam Clerk, we have a comment from Director Lima regarding this discussion, and then I believe she also might be live to give us an update.
Thank you, Chairman Patty. First, I'll read a couple of her comments, and I'm not sure if she has anything else that she wants to add. But earlier she wrote regarding questions for vendors doing testing. Testing numbers have been relatively flat over the last 4 weeks. Despite pushing and reminding through media avenues as reported by 2 of our testing vendors, one note of potential good news is that one of the vendors has stated they are finalizing a contract with schools to begin to test all athletes on a weekly basis. So we are hopeful that may improve our testing numbers. With regards to 211, she notes that 211 has all second dose and first dose open appointments that OES is coordinating. These do not include places like Safeway, Rite Aid, and the state's My Turn sites, et cetera. And again, she is available remotely if necessary or if the board has any additional questions.
Director Lima, if you're with us, if you can unmute, and I know we're finishing up this COVID discussion. Dr. Park's questions are done. Do you have anything additional to add as to what's going on through the OES?
Other than what Dr. Park has already shared with you, the numbers and information is all correct, and I don't have anything extra other than the fact that we are doing a really good job, I believe, of immunizing the ag workers. We've been working closely with Steve Gutierrez and El Concilio to provide special appointments for those folks, and we take a group off the top. So we're working closely with them, and I think we're doing a good job of getting that outreach.
Fantastic. A follow-up question from me. We were talking with Dr. Park, and when it comes to testing, and I know that we've got some of our team members out there that are working 7 days a week doing vaccinations, segueing from the testing. But if we need more strike teams for enhanced testing and levels of engagement and a little bit more perhaps mobility, do we have assets in place based on some of the mobilization that we put into the planning for mass vaccination events throughout the county?
We could potentially work on something like that. At this point, what I'm seeing is that there's just nobody that wants to be tested. We bring the testing to them at the vaccine centers. Saturday, I believe they were only able to test 13 people. There were other issues as well, but for that afternoon, that seems relatively low regarding the amount of people that we were able to contact that didn't want to be vaccinated. These are all things that we've been trying to figure out ourselves to promote getting people tested. They just don't want it unless they don't feel well.
Understood. Well, as we see in the private sector, when you need, car sales are slow, you ramp up your advertisement and you give some sort of levels of awareness and engagement and incentives. I know that we had a special meeting a couple of weeks ago talking about a potential incentive for some of the testing. So, we are looking for results. We know that it's all hands on deck. We're trying to meet all of the measurements and the progress that is required for us. So I would suggest that we keep looking, and no door has been shut. Let's keep all options on the table.
Absolutely.
All right, thank you.
Chair Patty, I just did receive an email from my EPIs. I did ask them to look at how many tests were being done since that special board meeting was held, and whether it represented an increase by the particular lab that we know our vendor uses, called Avellino Lab. And the week prior to our special board meeting, the total tests run by that vendor and run through that lab was 1,007. And the week right after, the week of March 27 to April 2, 1,136. So just the difference of 1,007 to 1,136.
That's not the additional 700 we needed daily. Was it a daily number? We needed an increase of 700 more tests per day. Is that correct?
Well, I tried to crunch the numbers and see how we had failed to hit the median the week of March 9th, March 16th, so on and so forth. And looking at all the weeks, there was one week where if we had done 334 more tests a day, we would have not had to suffer the state median coefficient, and we would have actually earned some credit to move that number downward. So it was as little, when I did the math, as little as 334 and as high as 650 tests a day that we could have used during those weeks where we missed the mark. That's not accounting for the fact that by increasing testing, you are going to find positives and you're going to have your case rate go higher. So as the case rate goes up, you need to do enough testing to really get that state median to be a negative coefficient and to drive that number down, so, which is why we had said a goal of 700 more tests a day would maybe really help to move us through the tiers.
700 more tests a day is an incredible number. If we're only getting 1,000 tests a day now, so we need to almost double, up by 70%.
Well, it was just that one lab. That's one vendor, one lab. We're doing about 15,000 tests a week as a county with all of our hospitals, urgent cares, doctors' clinics, the test sites that are set up through the state at Lodi Library and San Joaquin General. It added all up, and we're doing about 15,000. And what we really feel we need is maybe 20,000 tests a week for us to get that median, the corrective factor that would be in our favor.
Okay, well, we're looking forward to the results of where your brainstorming might go with Mr. Paulin, and see what we can do to hit some standards that would satisfy your requirements and goals and whatever we need to do to get there as a county. All right, thank you. Any other questions? Oh, Supervisor
Just real
Rickman.
quick, and Dr. Parkin, we spoke about this, getting into the schools for these testing, kind of piggybacking on what our chair was saying, and they're taking tests that aren't being counted. So did you look into that, and is that something you could discuss? I know you don't have to discuss it now, I guess, but, or send a memo to the board, how we can do that and the cost of that? I mean, if we're not getting credit for it, and we should, and that's a lot of students.
It's a lot of students. You know, football, water polo teams have to test, and now with indoor sports starting, they all need to test. So there's a mandate, and they have to test regularly, and so do their coaches. So I did have a talk with our superintendents, and many of them were interested in participating. Also, you know, with the message that you could have bigger proms and bigger graduation ceremonies. So maybe not the kids themselves would be tested in some districts. There might be some parents who don't feel comfortable with that, but could the parents come out and the grandparents come out to represent? And perhaps even the teams that need testing, could we do that for them because they have to do it anyways? Many districts are interested, and so we might target some of those locations. Some of them did share with me the testing methods that they're using. Some of them are going to the Valencia branch lab with their tests, and so that's the state-run lab, and that counts. But some are using the rapid antigen tests because they're wary of the fact that they have to have a result within 24 hours of Friday night football games, and so they feel more comfortable with the rapid antigen. That doesn't count. And then some of them are using PCR, real PCR tests with the best intentions, but they're using labs that are not CalReady approved. So they're PCR, but they're not being reported to the state, so those don't count either.
Well,
so I'm working through all of those.
I mean, if we could do it, if that's a possibility, I mean, we could have a turnaround as fast as possible, kind of like what our chair was saying, so we can put our numbers up so we can get out of these god-awful tiers that we're in.
Yep.
So thank you.
I couldn't agree more. I think it's a great idea, and it's an avenue that we're pursuing. Again, we need the testers. It's not so hard. We need bodies, and for every test you run, you need somebody a couple of days later calling the family with results. So this is what we need: is we need people running that show. And so this is the talk I'll have this afternoon.
I think our chair, you can make phone calls.
Absolutely.
Thank you, Chair. I'll yield back to you.
All right, thank you. Appreciate that. We're going to move on to our next discussion item, and I do have a change on our schedule. We have an opportunity to hear and have a staff report, I guess, on item number 4, which I believe relates to any discussion on item number 2. So, Madam Clerk, are you prepared to discuss item number 4, reopening county chambers?
Through the chair, I am. I would prefer if the discussion regarding public comments occurred first, because I think that feeds into where we will go with our reopening plans.
Sure.
And also, Chairman Petty, I do have 2 public comments for the first discussion this morning that I'd like to read.
Okay, proceed with those, and then we'll segue to the next.
Thank you. The first comment is anonymous and writes, SJC penalized again, missed testing mandate. Counties similar size, San Francisco and Santa Clara met the mandate. Number 1, why not SJC and no spending millions for gift cards so people test? Seriously, Tiffany Hayer, more wasteful spending. 2, any response from board attorney getting together with other counties to sue to open. 3, do hospitals have plenty of therapeutics, including the newest Regeneron antibody? And 4, how can Newsom blackmail the county by withholding funds? Idea, test more homeless, ag, canning and processing workers. This group has highest rate and equity metric. And the last comment was submitted by Theophilus Pope, who writes, you have the power to stop COVID-19 emergency order. According to California law 4-3005, power and duties of the Director of Emergency Services and Director of Emergency Operations A1A, the Board of Supervisors shall review the need for continuing a local emergency at least once every 60 days until the board terminates the local emergency. B, the Board of Supervisors shall proclaim the termination of a local emergency at the earliest possible date that conditions warrant. I urge you to say no to the, quote, local emergency, end quote, based upon COVID-19. Only you can determine, quote, what conditions warrant, end quote, a local emergency. And Chairman Patty, this concludes public comments for this item.
All right, we're going to move on then to our next items in public discussion. Public comments have come in as it relates to the item number 4 and I'm sure item number 2. Is that correct?
That is correct.
Let's go with public comments then, please.
Would you like to start with public comments before the presentation?
For item number 4, which is now number 2?
Okay, absolutely. I can go with that. I don't have any public comments for item number 4.
You do not. Okay. So then do a presentation on item number 4, please.
As you wish. So Chairman Patty, first I would like to thank you for hitting the ground running in January and immediately looking for ways to improve board meetings in an effort to promote good governance, and appreciate requesting that this item come to the board today. I also want to thank Supervisor Miller, who was chair during 2020 when this pandemic hit us. Her experience having governed during a crisis in the past was a tremendous benefit to her leadership over the past year. I also want to thank the full board for their input, County Counsel Mark Miles, Interim County Administrator Manuel Lopez, our current County Administrator Jay Wilverding, and our Public Health Officer Dr. Maggie Parks for their input on this item. As you know, in March 2020, Governor Gavin Newsom issued Executive Order N-2920, waiving Brown Act provisions requiring the physical presence of board members or the public to attend and participate at board meetings during the ongoing COVID-19 pandemic. It's no understatement to say that that was a chaotic period of time. As those guidelines were coming out, they were being updated not only daily, but sometimes hourly. We were getting new guidance and new direction on how to proceed with our public meetings, how to provide public input, and we implemented many of our decisions to close the public participation in board chambers and allow written public testimony based on guidelines that were happening throughout the state. And again, that happened very quickly. Back in March 23rd, 2021, the board directed us to develop a reopening plan to, again, allow for greater public participation at board meetings. So I did reach out to our county council, our CAO, as well as our 10 comparison counties and our public health officer. The majority of our counties are in the red tier. Currently, we are, of course, obviously still in purple, with Fresno also in the purple tier and Santa Clara in the orange. And the majority of counties throughout the state are doing mostly remote board meetings. We have about 36 counties of our 58 counties that are allowing for remote participation by the public. There are a few that have a hybrid that allow both in-person and remote participation. So what we're recommending today for our guidelines is to be consistent with the guidelines recommended for places of worship and following along with the tiers that have been developed by the state. So the purple tier and the red tier both allow for limited capacity in-person participation at our board meetings. And then as we move to the orange and yellow, we would simply increase that capacity based on what's permitted by the state. I recommend that we do continue allowing written public comments following the discussion item number 2. That will determine what that will look like. And following that discussion and this discussion from the board, ISD is currently developing a protocol public comment form that's going to help us and also, I believe, help the public submit their public comments within the word limits that are established by the board. One of the issues that I've had, regardless of what the limit was, 250 or 100, their comments would exceed whatever limit it was, and I would have to cut it off at a certain point, sometimes missing maybe the main point of their comment that they wanted to submit to the Board of Supervisors. So by having this form that will direct them and show them what their word count is and limit their comments to what the word count is, this will allow them to tailor their comments specifically to what they want read during public comment. It'll also allow them to attach written correspondence that can be submitted for the record but will not be read during the board meetings. And then there are several options that other counties have developed and that County Council has explored. And one of those options is taking the public comments that are received up until a specific time period, such as 5 p.m. the day before a public meeting. Those comments get routed to the Board of Supervisors so that each Board of Supervisors has those comments available to them and can read them before making their decisions on agenda items the next day. Those comments would become part of the record, but could, if the board chooses, not be read during the public meeting. Any comments that come in during the meeting would be read because those would not have been received by the Board of Supervisors. So the whole goal with public comment, of course, is to get the public's input prior to making any decisions on the agenda, and then second, to hear any items not on the agenda that the public wants to share with the Board of Supervisors. So that's always our goal, and depending on, again, how the board wants to go this afternoon or this morning with the word limits or any input from the Board of Supervisors on how they want to proceed with that portion of the public comments, they could consider having them distributed the night before. And that form that ISD is developing could be set up to automatically send those public comments to the full board. So there's no delay in receiving those comments through the clerk's office. They would automatically go to the Board of Supervisors and the clerk, and then they would be uploaded, as we've been doing with public comments, online for the record and for the file going forward. With reopening, we would want to implement certain safety measures for people entering into the board chambers. I'm proposing temperature checks and a self-screening where we do ask if they've been exposed to COVID or if they have any of the common symptoms of COVID. That would be, a self-certifying. We're not going to test people other than possibly temperature checks if the board is interested in that. And then we would continue to promote, mask wearing would be mandatory. That's unfortunately state law, social distancing, and we would encourage people that once their item has been heard, if they're here to speak on it or hear it, that they go ahead and exit the chambers. We would not force them to leave, but we would encourage them to do so because, of course, prolonged assembly in an enclosed space does increase the risk of spreading the virus, and we want to avoid that. Every effort would be made to protect our staff with proper PPE equipment. We would have staff stationed at the door. We would have overflow downstairs on the first floor. Our capacity would be limited in board chambers in the purple and the red tiers to just 56 people, 12 people out in the lounge area, and downstairs we'd be able to take an additional 21 people. So briefly, if you recall, back in June of last year, we did open up board chambers for a short period of time when the governor relaxed some of the guidelines right before, again, changing them and closing us back down. But we implemented this policy of having a check-in and an overflow. People were able to come in and make public comments. They did so perfectly as we had planned. We never needed the overflow at that time. And that would allow people to come back into board chambers and make their public comments. And it would also still allow people who cannot travel or who still have to quarantine still get their messages and their comments to the Board of Supervisors through written comments. So I do ask the board for some direction on public comments, and I think that will tie into the discussion that Supervisor Nguyen is bringing to the board as well. Excellent. Thank you, Madam Clerk. So I think this is an actionable item if we're going to decide to open up the board or not, the chambers. So you've mentioned a couple of things after that you looked into what other boards and
Board of Supervisors or other councils may be doing when it relates, as it relates to public comment, separating that which is relative to an agenda item, and then anything that's just a public comment about whatever else that's not related to anything on the agenda is at the end of a meeting. When I attended a Board of Supervisors meeting in Los Angeles, that's exactly what they had done. There's several mechanisms available if we wanted to start to delineate, and as we open up our chambers and do a hybrid system where we're allowing multiple levels of engagement, which is what we want, and accessibility is important. So I'd like to see what the board feels about the idea of receiving emails the night before up to 5 p.m. and anything after that anything submitted after that goes through the clerk. That's one question I'd like to get some feedback from the board on. And then if we wanted to delineate and separate that which is related to an agenda item and that which is related to, community opinion, a person's opinion in our community. So I'd like to hear from the board on that. As for the 100 or 250 word, that's an irrelevant conversation. That's separate from this item, so we'll address that afterward. But the question is, if we want once we open up the chambers, do we want any level of change to that 250 word or modification to the 100 as it relates to opening the chamber? And then lastly, County Council, I wanted to inquire from you that based on some information you shared yesterday and what we'd seen with other boards, is there seems to be some possibilities, whereas if we're getting 30 submissions on a subject that's the same, we could or could not surmise what that is based on the repetitive nature when we're without much delineation of that message. Is there a mechanism, and while we may or may not modify and surmise what multiple submissions on the same subject may be when they are redundant, but there seems to be a mechanism where there's like X amount of time where they're allowing the public comments and then the rest will be put into the record. So I'd like this board to discuss that. And again, not looking to silence anyone, looking to see what we're doing as it relates to efficiency. We've got multiple departments in the room. We have time management coming from the private sector. I try to be mindful of taxpayers' dollars and how productive we are. But in every capacity, the public's engagement with us, whether it be in person, telephonically, or in submission, is of paramount value, and we're not looking to minimize this in any capacity. We're just looking to see what other boards are utilizing and consider it if we want to bring this into our board or not. So those questions said, County Council, do we have a couple of options as it relates to what I've just mentioned?
Sure. As far as setting a time limit, the Brown Act specifically allows the board to adopt reasonable rules to ensure that the public has the opportunity to engage with the board and to speak on items that are on the agenda. And that includes setting a maximum allotment of time on a specific item or per item basis to receive public comment. The law does allow that. As far as being able to summarize comments when there is a certain volume has been reached on written comments. If the board, I believe that the board has the ability to adopt that rule. I believe that goes along with the idea of being able to adopt reasonable rules to ensure that that people have an opportunity to participate, given the amount of time, given the number of comments that are available, and given the length and number of items that are on the agenda.
Okay, so mechanisms do exist. Now, is that, for instance, we've had instances where we've had, let's say 50 or 60 or 70 members from the public coming in representing an organization, and in light of that volume and the nature of what was very important for them to show up and discuss and share their opinion on, it was Supervisor, then Chair Villapudua had enacted a 1-minute time limit for somebody to come on up and speak, and they did. They came up and they expressed their voice and opinion, and that was done at that time in light of the fact that there were dozens upon dozens of people representing this one issue. Do we need to have board action defined as to having that available on the rare occasion? It's not obviously frequent, it's not every meeting, it might be 2-3 times a year, if that much at all. Do we have the ability, or does a chair or the board at the time have the ability to utilize some of this modification in light of the fact that we have 20, 40, 60, 80, 100. I'm just exaggerating, but in the past we have seen up to 70 or 80 submissions on a subject. One of them was golf. One of the golf courses, we had 70-something submissions of support, and we surmised it with the announcement that 70-plus letters had come in support of opening up golf courses. So that was a modified moment given the context of what we were dealing with at the time, and I didn't have any objection to it. It was, that was fine. I didn't think it was necessary to read 70 letters on the same subject as when it came to golf courses. I think it was an important representation of the interest from the public as it related to that subject. So, do we have to pass the guidelines and abide by them, or are they amendable given and in light of what might be present at the moment?
Both. So because the board is available, and because, so let me back up to those two comparisons that you made between a situation where you have 70, 80, or 90 people who are present, and you tell them you have 1 minute. That allows them to tailor their message to fit it within that specific time frame, as opposed to you have set a 250-word or 150-word minute or limit, and then because the volume that is received, now we're going to summarize it, and you've taken away that ability for the individual to tailor their message, right? And instead you've placed that in the hands of somebody who works for the county is now going to try and summarize that message, and I have significant concerns about that. But I believe that if the board is willing to adopt a rule that allows for that to occur when certain circumstances exist, whether it's the quantity and whatever quantity is deemed appropriate, that and then gives the chair the discretion to implement that rule when that situation arises. That's why I say it's both. It is for the board to adopt the rule that then gives the chair the ability and the discretion to determine when to apply it.
Okay, understood. All right, well, then let's bring it to the board to discuss what's before us about opening up the chambers for public comment, and as it relates to any level of or the utility of being able to surmise when a subject is redundant and repetitive, as we would if multiple people are present saying the same thing and we're asking for a 1-minute presentation instead. So, Supervisor Rickman, anything on this issue?
You know, I know Supervisor Miller and yourself have led this, so I would want to hear from you guys first. But for me, I think in relationship to opening up the chambers, I think it's a must. And we talk about essential activity. If we can allow people to go to Costco and Michael's to buy a picture frame, then the public's right to engage in the legislative process and their elected representative is just as much as essential. In fact, it's a fundamental right. So for me, I want to see, people sitting out there and coming up to this dais if they wish to do so, and that's my number one concern at this moment. So, and I'll hold off on until I hear from some other boards or supervisors on the others.
Sure, and you'd be in favor of, as would I'm sure all of us, but opening up the chambers, but also keeping open other levels of submission, including email and the public opinions being read, public comments being read.
My big issue is that it has to be fair. If those folks come up here and they're allowed to speak, they shouldn't get more or less time than somebody else's writing in a letter. So we're gonna. If somebody comes up here to the chambers and they only get 1 minute, then everybody needs to be treated fairly and equally, so we all have the same opportunity to engage their elected representatives.
Understood. Supervisor Villaputo, anything at this time?
You know what? I have no problem opening up the chambers. I think if you want to come, I think every other chair or 2 chairs apart, I think it would work.
Mm-hmm.
People want to come. They should be able
Excellent.
to come.
Okay, thank you. Supervisor Miller, any comments on this?
Thank you. Yes, first of all, I have a question. When you were talking about telephonic participation, does that mean that the public, if they can't be here physically to deliver their own comments, they would have the option of phoning in and participating in the case of whatever the time limit is to deliver their own comments personally?
So in the past and going forward, I would continue to recommend that only be allowed in limited situations where it's a quasi-judicial public hearing or other similar items such as that. And the reason for that is currently we do not so we're using Microsoft Teams to do our remote participation. There are some limitations with Microsoft Teams with regard to monitoring and controlling public participation, ensuring that we're calling on the right people at the right time for public participation. In speaking with other counties and how they are administering telephonic public comments, it is extremely labor intensive and just as time consuming as reading public comments. So I currently do not recommend that we allow just open telephonic participation. I would prefer that we continue with written comments and open board chambers with limited capacity. Through County Council's office, we have, though, offered additional opportunities, like I said, when it's a quasi-judicial public hearing, when we had the bid opening, these are important items where we want to ensure that people can participate because these decisions directly affect that individual. So in those cases, we would still continue to offer that. But for general public comments, I don't recommend that we implement a telephonic participation at this time.
Okay, I appreciate that, the staff time. I am also concerned, though, with being fair to all the members of the public in terms of their ability, and for a lot of folks who have access issues to coming here. Some of those same people have access issues with emailing and computers and all of that. A telephone call is quite a bit easier for them. But I do appreciate the fact that hopefully this isn't going to be for that much longer. And I would like to maintain the ability of folks to be able to submit their comments in writing, even when we are fully reopened. I think that is, I just think that's a best practice in terms of allowing more accessibility to the public. And so I would like to retain that ability. I agree, though, that if depending on how the next discussion goes, if that limit is going to be 250 words, which is actually a little less than 3 minutes, but it's kind of in the ballpark. It would be difficult then the next day to limit the folks that show up here to 1 minute, because they would not be getting as much time as others who submitted in advance. So I'd like to maintain some consistency and equity there, so that whatever, for a particular meeting, whatever limit is set, and if this board decides that written comment will be 250 words, I think we should stick with that. I am not a fan of summarizing. The only time I think that that is appropriate is when we are receiving scores of form letters, where they are literally the exact same comments, in which case, then I am comfortable with accepting those comments, reading them out loud, however they're going to be delivered, and then saying these comments were signed by 60 individuals, or and we have encouraged folks to do that on issues when they're delivering public comment here in person. We have said to them, if you are representing a group of people, we encourage you to designate one or maybe two spokespeople, come up, make your comments, and then simply state how many people you are representing. So I'm comfortable with that in case of summarizing, but other than that, I don't think that's your job or staff's job to do summarizing. I think it's better to set consistent limits. Everybody gets used to what those are, and everybody always knows that they can submit detailed comments in writing to be distributed to the full board. Now, whether or not those will be read, that's a very different story, and there really is no substitution for having those comments read in public if part of the purpose of delivering them is to hold the board accountable publicly for decisions that's before them. So I like the idea of receiving the written comments in advance, but I don't think that should eliminate them from being read during the meeting. From my standpoint, being read publicly, that is an important component. There's a reason why they're called public comments. It's not just because they come from the general public, it's also because they are delivered publicly and anybody watching the meeting can hear them. And so from my standpoint, I would hate to think that the public has to make a choice between having their input heard, or they know this board is listening and hearing it, or submitting it in writing where you don't know if, there are some members here of this board that don't receive, open, read, or consider emails from certain organizations or certain members of the public. So for me, having those public comments be delivered publicly is an important component. I think I covered most of the questions on that. So if...
Follow-up question for you, Supervisor Miller. So if we were to have, like, as the example pointed out, we had 70 plus letters that were sent in regarding opening up activity. And what would be a number? Is there a comfortable number that, let's say there was 10 or 15 or 20 or 40 or 60 or 80? I'm just throwing out random numbers. What would be a number, if any, and I understand your point, but what would be a number that you would consider as, if we've got 10, 20, 70, 150, again, exaggerating, there's a full gamut. We have 500 submissions of the same subject, not just a form letter, but 500 people have said the same exact thing because it's unfair that the squirrels were treated a certain way, and we believe all squirrels deserve a nut. And we had 500 submissions, or if we had 10 submissions. Is there a number that you'd be comfortable with, or would you just prefer leaving it alone and letting those, so that, again, trying to be respectful for taxpayers' dollars, efficiency for our department heads that are oftentimes here when we're running through a gamut? When would it be a number that could trigger the mechanism for the chair and advice from the board to say, this is a very redundant message. This kind of triggers that, where we know that, X amount of people feel this way about squirrels getting a nut. And we've got, 250 words submitted 10 times, 20 times, 70 times, 100 times. You get my point. Is there a number that you would consider?
I do get your point. I know you're being facetious about the squirrels, but
it's just an innocuous subject.
I guess what I would say is, if you said two things. One was, you said the exact same comments coming in. That's one thing, if they are the exact same comments. Mm-hmm. But if individuals are making different points for different reasons, depending on their perspective, perhaps it's based on where they live. And they have a very valuable perspective that the folks in Acampo feel very, very differently than the folks in Tracy. Or if somebody if they're touching on different aspects of the issue, then that's exactly the kind of information that the board should hear and should consider before we deliberate and we make a decision. I mean, the whole point of it is for us to be made aware of how our constituents might feel about a particular issue, and we may not be aware of that at all. I mean, a perfect example of that is Supervisor Wynn's question to Dr. Park earlier, and him saying, I'm hearing from everybody that they want everything open back up. What are you hearing on your calls? And Dr. Park saying, from a public health standpoint, the public health officers actually have the opposite position. They are concerned about reopening too quickly. And so that's an important bit of information for us to get, and we could be getting that kind of information. And in fact, I would say we probably do on most issues. And so the whole point of public comment is to get different perspectives. If they are the exact same comment for the exact same reason, the exact same perspective, then I think it is fair to summarize them. I have a group of 20 individuals who have stated this, and you simply read that one point. Mm-hmm. But I don't think,
just for clarity,
I wouldn't pick just an arbitrary, 20 and then that's a cutoff. I think it depends on the comments, and from my perspective, I would choose to err on the side of providing the public access to this board and being heard. Mm-hmm. I don't think it happens that often. I mean, just today, we talked about moving the meetings along. You, Supervisor Rickman, and Supervisor Wynn all took more than 15 minutes each for follow-up questions, and quite a lot of that was not questions, it was comments about the state's position and all these things, and that happens every single COVID update. I'm not going to say that the supervisors don't have not only the right, but the obligation to voice the perspectives of their constituents. But what I am saying is that I don't think to say that it's public comment that is bearing the brunt of why the meetings are running longer. I think the meetings are running longer because we're dealing with a pandemic that's extremely complicated. We've been operating under tremendous constraints for over a year. And the supervisors want to understand it. And they also want the people they represent to understand it. I don't think that's going to be changed by restricting the public's ability to have access. So from my standpoint, I would err on the side of having the public's ability to make their voices heard publicly. I don't think that's what's a make or break for here. I sort of feel like Supervisor Villapudua. I would like to open it up, give people a voice. I think that's the main part of our job. And so I don't have a problem with, I mean, we have had meetings before where we have literally had 150 people show up in uniforms with signs, and in that case, we have asked them to designate a spokesperson and to have one or two. I think that's appropriate. It doesn't happen very often. That's
Understood.
happened
Yeah.
two or three times.
So I get what you're saying is, like, for instance, we wouldn't want the 5 p.m. the night before submission to the supervisors because those are public comments that they want to have read, and I understand that. But you've also said that if a message is redundant, and does that mean only if it's an exact same letter, or if the message is hitting the same 3 points? You know, you can decipher, if you're looking at a message, you can pull from it the talking points of it. You may not get the "I reside in South Stockton and I believe blah, 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 blah." You're going to say that the "I believe" part is all the same. But the I live in South Stockton, and maybe the closing of, "and this is very important to me," may be different. But the context of the letter is the same. It's repeating the same message. Would you be in favor of the board being willing to just have that in a summation? We can give the name. We can give the talking points of what they stand in conjunction and support of. Or we don't. If we want to, we can put a number on it. We can leave it alone. I believe County Council has defined that we should have some direction. I don't think that any chair can do this randomly without direction in advance from the board as to what might, or that might be permissible. Is that correct, County Council?
That's correct. I think that the board should set some parameters around it to provide guidance for whomever the chair is to use when they elect to exercise their discretion.
Okay, thank you. So we do, if we're going to have parameter in this discussion, and that was one of the triggers for why we went from 250 to 100, that we'll discuss next. But, is there a mechanism? Is there a number? Is it just an occurrence for the rare occasion when we're seeing 25, 50, 70 of the same exact talking points? May not be a form letter, but it's the same exact talking points. Does the chair have levity to make that decision in light of the fact that we have so many submissions? That's the question. If that's something the board wants to allow.
Chairman Patty, if I may. I would just like to clarify really quickly on when we do receive public comments that are exactly the same, and we receive multiples of those form emails, we do currently and will continue to only read that one time and list the names of the people that have submitted it.
Right.
And then with regards to summarizing, I would ask the board to consider, if they do go down that path, that if possible, we would need to set a time limit of when those comments can be received, because the clerk's office would need time to read those comments, determine what the point is of those comments. Sometimes it is not clear what position they are taking, and we may need to, of course, read some word for word, but we would need time to summarize them. If we did it during the meeting, I think it would take longer than just reading the public comment.
Understood. Would you say the majority of, when you've gotten 50 letters on the same subject, would you say they've come in the morning of, or they've come in a day or two prior?
So far, I see that public comments generally come in over the weekend leading up to the meeting.
Okay, so that would address it if it were, you'd have ample time for it. And again, it's not looking to silence anybody, it's just looking to, pair together what, as we did with the golf courses, when people were saying, please open up golf courses, we had 70 letters that we surmised in in a minute and a half. And it was a point that we understood. There were 70. If we read 70 letters, that next hour and 20 minutes, we could have heard repetitively the same thing. Open up golf. It's safe. It's outdoors. And it's part of what somebody needs for a healthy lifestyle. So again, Supervisor Miller, just asking your feedback on that. Would you think, do you feel that it's okay for the chair to have the authority or for the clerk of the board to utilize that mechanism of surmising a repetitive message when sent far enough in advance, and there's dozens of them?
I would say unless it's a form letter, no, we should not be.
Okay, that's your opinion. Supervisor Wynn, I believe you would like to weigh in on this.
Thank you, Mr. Chair. A couple of questions. First of all, in regards to, I understand the COVID protocol as far as temperature taking, et cetera, but how, because I think it's been indicated that there would be, it would include the board, the staff, I mean, all the members would go into that 56, is that correct, as far as individuals within the chambers, correct?
That's correct. So last year when we did this, we counted up the minimum number of people required to be in the board meeting, obviously board members and the staff required. And then, I want to say it was, I think 12 is the minimum number of staff necessary to run a meeting. I think we could go as low as 11 if I did not have a deputy clerk assisting me with the meetings. So knowing in advance how many are going to be in the board chambers that have to be here, then our staff outside of the chambers counts up from there to determine when we reach our limit. Then we would have overflow of about 12 right outside board chambers, and we would have the meeting being broadcasted on the first floor in the meeting room and a staff member stationed there, so that if there were members down there that wanted to make a public comment, when that item comes up, they would be able to come up in advance of that item, come make their comments, and then leave board chambers.
Okay, well, so, but I guess my question, as we see here today, there are certain members of county staff that would be here. The CEO, for example, would be one, and maybe the deputy CEO, and obviously others. So, but you would kind of want who is going to be here. In other words, notify you that they're going to attend, maybe because they have an agenda item they have to present or whatever. But then that subtracts from the total. And then the next question is, okay, so if we have individuals from the public that want to attend, as far as, and I see the way we're here, but I've been to a couple of events. In fact, last Friday I went to a show, to a movie, which was interesting. Not in this county, by the way. But what was interesting is it's always been reserved seating, but what they did, and because we talk about families, and so you sign up on the seating chart, and there were 7 of us, and not all from the same family, by the way, but signed up. And then what they did is they went in and then they put 2 seats next to that you couldn't sign into. So it was kind of, you decide where you seat, and then we'll make sure there's the distancing, et cetera. I don't want to make this complicated. However, is it based upon what we see out here? Is your intent to pretty much do the same thing? Because I don't think there'll be many family members that'll attend together. So we're going to have 1 person, 2 vacant seats, et cetera. Is there any consideration that if 2 or 3 people have traveled here in the meeting, that they can sit together in the meeting, or does that totally violate the CDC rules?
Through the chair, Supervisor ran a very valid point, and we did look at what are some reasonable ways that we can regulate that, and that is really difficult for us to regulate, and I would not want myself or my staff to be responsible for policing the seating. So what we would do is maybe make it even more clear which rows are closed off, to keep the rows separated, and honestly leave it to people to self-guide themselves to seating. I think we would put up in our introduction when they come in to socially distance, have proper signage, let them know as they come in that they need to socially distance from members that are not within their household, to leave a minimum of 2 seats between them and other members of the public that are attending. And we would continue to encourage staff at that point until And if we see that there's not a lot of public participation, or we're able to increase our capacity up into that 100 number, we would encourage any non-essential department heads to continue to participate telephonically. So instead of having, for example, the assistant CAO here in chambers, they would watch it telephonically, and everyone else as well, unless they have an item on the agenda that, and even then, they could still participate telephonically. We've done PowerPoint presentations with E2D2 where they participated telephonically. It's not the best option, but if there is going to be a lot of public, we would rather the public be able to be in here, and department heads have the ability to do telephonic participation, and we'll continue to have that.
Well, I noticed a lot of department heads use these two adjacent rooms, during the meeting, and only come in when it's time for them to speak. So I assume that would be something that we would consider in regards to staff, not using, especially if we're going to have, a lot of people, that they wouldn't be in here. They would be out there until they're needed. So I appreciate that. In regards to the repetitiveness of the comments or whatever, I don't have a problem getting a copy of the letters that are sent in. You do some now, and obviously we don't get all of them, but we receive them. And it's always helpful to have kind of a preview, I guess, before the meeting itself. So I would say I have no problem sending those meetings when you receive them directly to the board members. Secondly, I think in regards to as you had mentioned, the new system ISD is putting together will hold the comments to 250, so that's not going to be a problem counting them. And everybody who fills out that form will know that I got to put it in this format, so that should take care of that problem as far as being succinct in regards to the message. I think as far as so if they submit a letter on the electronic format, then that would be read at the meeting. But I think obviously, it's not just for the board members to hear, it's for the public to hear, because it is something that others may find they support. So I think that should be done. The repetitiveness part of it, though, is, and I would agree in regards to form letters, because we've all received, I think in one time it was about 117 of the same letter. And I would agree that those types of repetitiveness, you can just list the names of people who submitted it, so at least they get recognized that they actually participated. The other part of it, though, is a little bit tricky when you get to the points of, I guess, a disagreement or argument or whatever. I've received a lot of emails recently on a particular fact. Mr. Wong has been working on a cell phone tower in my district. I've gotten a lot of emails from parents very concerned. It's interesting because they're very similar in their content as far as their arguments, but they're different. They talk about their children, or they talk about studies or whatever. So they're not the same, but the gist is the same. But I would expect that we read every one of them, because they are written not in a format style, but they're written individually where people have actually put in their own comments. I think those should be read as opposed to a form letter. And I think, as Chair Patty talks about, I think that as far as the discretion of the chair, I would say that's part of the leadership of this board to make determinations. But as far as guidelines, as far as numbers or whatever, I just think, frankly, these particular issues that have arisen in the past have been dealt by the chairs and just basically using their common sense as to what's appropriate, what's not appropriate, what's redundant, what's time wasting, all those things. And I would leave that to the discretion of the board. However, I think for the things I've already mentioned, as far as an individual writing, I think that should be read, even though it may be similar to 10 others that were read. I think that the form letters should be summarized or read once. And then when you talk about telephonic, I would agree that becomes unwieldy, and we've had enough problems with our telephonic communications. So if somebody is here, they should, as they've always had, an opportunity to come down and speak for 3 minutes. And as the exception, which we've had in the past, if there's some type of overwhelming attendance, the chair at that particular point can, because of the repetitiveness, can hold it to 1 minute. I think Chair Villaputa did it when he was the chairman. And so these are things that I think would be appropriate in managing our open meetings, because I think it would be appropriate for the public to participate as much as possible. And, you know, we can sit up here and say, well, I've heard that before, or I've read that before, or I've spoken to somebody that before. That's fine, but I think everybody who wants to take the effort to make their voice heard needs to have that opportunity, and I think it's our job to hear it. I don't think that we should say, oh, I've heard that before, go away. I think that's inappropriate. So again, I don't know if that's given you enough, and I guess with Mr. Miles in regards to the attendance, I assume it'd be as far as first come, first serve. Once we're full, and then they go to the overflow, and if the overflow fills up, then, you know, I guess they can attend on their phone or whatever, you know, through our video system. But I know what I'm saying is there's no prioritization. Nobody gets in ahead of somebody else. Everybody has the same opportunity to come in the chambers, and if they want to speak or listen or whatever they want to do, they're free to do that without any discrimination, so to speak, on particular individuals. Even if they're wearing a particular colored T-shirt, et cetera, that would have no bearing on their admittance.
That would be correct. I do agree with what the clerk has said, that if we're going to limit the number of people, though, it's appropriate to encourage people to, come for your one item, speak on your one item, and then leave so that somebody else can come in your place and speak on their item.
And if that were to occur, for example, let's say there's a lot of people on a particular issue, if one of their speakers spoke, which left a vacancy in the room, then somebody else can come in, and they would have the same opportunity to speak. They would just have, now, I assume they would still fill out, I'm asking about the paper, so to speak. They would still fill out the same paper in the back, or how would they, or would they do it out in the foyer as far as notifying that they need to make a presentation?
So Supervisor went through the chair. We would not have public comment forms, because then we get into having to provide sanitized pens and the transferring of paper, which there's still some evidence that it's possible to transmit the virus that way. So we would continue to do what we did last year in June, where people would come up and queue, where we've marked off 6 feet across. If we have people in the overflow, the staff members attending to that group would determine who there is wanting to speak on a public comment, and we would coordinate that to make sure that they come up at the right time to make their public comments.
Okay, so in that particular process, would the chair call their name? Would we know who they are?
If they wish to state their name, they could do so at the podium. And the chair does ask that they state their name. They're not required to provide their name, which has been another deterrent to the telephonic participation. Without their names to call on them, we really have no way to identify them. They can self-identify if they wish, or they can speak anonymously.
Okay, well, I'm just trying to figure out for the chair how the chair knows just call on somebody or call on just people making a public comment.
I would envision that he would announce the public comment period for a particular item. We would give people an opportunity to queue. I would be coordinating with my staff if there's overflow to find out if anybody there is wanting to speak on the item, and communicate with the chair that we do have people coming up from the first floor that wish to speak on this item, and give them an opportunity.
Okay, good.
And
Thank you.
also, to your point about the receiving the public comments in advance and those being available to the public, I recognize that you and Supervisor Miller are probably both indicating that you want the public to be aware of those public comments in advance of the board also taking action. But we would, if it's any consolation, and if the board wishes to go that route, those public comments that are received and routed to the board members, if they're not read into the record, they are made public through our website and through our agenda. They're uploaded, and they would be available to the public to see what public comments came in. And I think it would be appropriate that if we were to do that, if we were to have public comments that are sent to the board members the day before, that we would announce during the meeting that public comments have been received and will be available to the public, so that they're aware that there are public comments out there related to a specific item.
Well, when I say send them to me, I guess, I'm just saying send it to me. I'm not talking about changing the process during the meeting. Still read it. All I'm saying is that I have an opportunity to see it in advance as has happened periodically. But it doesn't negate, that particular letter or whatever being read. And I'm assuming most of the things should come to you electronically based upon the new format that ISD is preparing. So, and then that question is, if it goes into that format, will it come to us in electronic format also?
Yes.
So I'm not suggesting that we don't read them. I'm just suggesting, given as a heads up, that we see them before they're actually read in the meeting.
Correct, but that was brought up that it is possible that to Chair Patty's desire to, have effective meetings that are productive and move along timely, and through County Council's office, other counties have done it where those public comments are not read into the record during the meeting. So they're received by the Board of Supervisors prior to making a decision, and then those public comments are uploaded to our website and available to the public, probably generally within 24 to 48 hours. So not before the item on the agenda. The board would have those public comments before the item on the agenda, and that would only eliminate a group of public comments from being read during the public meeting. They would be received by the board and again uploaded to the website. And then any public comments that are coming in during the meeting are also being read to the Board of Supervisors, as those would not have been received prior to the meeting.
I'm not quite sure when you say they're not read or they're available. My thought is everything is read, period.
Correct, but there is an opportunity to discuss and for the board to decide if they're wanting to. And what I'm hearing is that you and Supervisor Miller are not interested in receiving public comments that are not read into the record the next day.
I think what we're saying is that everybody's comfortable. Supervisor Miller and Supervisor Wynn have expressed that even if it's received prior, they want it read. And as Supervisor Miller points out, that oftentimes these are being submitted because they want them read into the record out loud and to those that are gathered. So I appreciate very much that you've looked into what other boards are doing to be effective with their time, so that sometimes when on occasion when the meetings are hijacked by a certain narrative, they've got ways that they manage their time to be more efficient with taxpayer dollars and the staff that's present. But I'm gathering that this board's not interested in anything like that on the rare occasion when it happens. So I think at this point, barring any further discussion, we're just going to approve you going forward with the mechanism of reopening our chamber. And I think all the other discussions at this time are mute. There didn't seem to be any interest to make any modification other than accepting written and in person, which for the record, we've always received or been open to written submissions. Is that correct?
That's correct.
It's just been utilized more so during the pandemic.
Correct. So prior to the pandemic, if we received written correspondence regarding an item, that was always distributed to the board and then uploaded to the item after the meeting.
Understood. Okay. So now we're going to read them in public, even though they're received in advance. We'll read them into the record and we'll allow public comment in person up to the 3 minutes. And so we're basically just approving. We're going to need a motion and a second and a vote to approve reopening the board chambers.
And through the chair, I'm sorry, Supervisor, I do want to point out that one of the recommendations also is to allow the county administrator's office to modify the order of items on an agenda so that we could utilize having all of the public comment items at one time or in advance, or to space them out so that we can help kind of mitigate the public coming into board chambers and sitting for a long period of time.
Okay.
Chair, I just want to make a quick comment on that. There was a mention of having public comment at the end. I've been in those meetings. They are killers for public comment. I would say where the public comment is currently should stay where it is, as opposed to the end of the meeting. So especially when we're wanting people to leave, when they're finished with their business, whatever it happens to be. So I'm not saying that's going to happen. I'm just saying if that's a consideration, I would be totally against that.
Through the chair to Supervisor Wynn's comment, the Brown Act recognizes two categories of public comment. So public comment on items on the agenda, they're required to be heard before the board takes action on those items. the public comment on items that are not on the agenda. That's the one that oftentimes you'll see that boards and commissions will move that to the end of the agenda so that they deal with all of the agendized business first before getting to those unagendized.
And that's what's being proposed today, County Council?
That was one of the things that was included in the document that I sent you yesterday, and in previous correspondence we spoke about that.
Right, but as it relates to, as Supervisor Wynn's pointing out, the way we're currently structured, and then it's being proposed, as our Madam Clerk just pointed out, that we break up the public comments as much as we did today. Is that correct?
Chairman Patty, not necessarily. In fact, I would actually recommend against that right now because, as Supervisor Wynn pointed out, we're wanting people to come in and leave as quickly as possible. And I don't know through County Council if we could maybe reserve reading public comments that are not related to the agenda at the end of the meeting, possibly. But for in-person, we want people to come in and leave as quickly as possible.
Okay, I'd have to go back to my office and rewind what you had just said, but I had mentioned and said we're looking for a motion to approve opening up our chambers, and then you just went into we're actually also looking to accept an amendment to the process of what we're reading. So now you've just said, no, we're not. So
I apologize for the confusion. It was not specific to public comment. So one of the recommendations in allowing us to move items on the agenda include discussion items, public hearings, COVID discussion items, all of those items. Having the ability to move those around. They're currently in board rules set up in a particular order. We'd like the ability to move all of those around if necessary to encourage people to come in, make their comments, hear those items, and leave. For example, if we have a lot of public hearings, we may want to do that before we do appointments to boards and commissions and consent calendar.
Understood.
So having the flexibility to be able to do that may help us mitigate how many people come into board chambers and how long those people are in board chambers. With regard to public comment, that's been a conversation that we've had, I think, long-term and going forward in a permanent manner of putting non-agenda public comments at the end of an agenda, which is something that we can pursue. But for the immediate need, I think during the pandemic, I wouldn't recommend that piece because we do want people, again, to come in, make their comments, and move on.
Understood. Okay. Well, then we need a motion for the staff, CAO's office or the clerk's office to make changes to the structure of the agenda according to what you're thinking might be suitable based on public participation.
Correct. So the recommendations today are to approve the public meeting guidelines in response to COVID-19 pandemic to safely allow for open and public meetings of the Board of Supervisors, direct staff to take necessary steps as may be recommended by public health officials to safely implement those guidelines, and to authorize the county administrator through the clerk of the board's office to reorder agenda items from time to time to reduce the duration of in-person public participation.
Okay, thank you.
And
So look for a motion in a second.
Real
Yes,
quick, I
Supervisor.
just have one clarifying question. Is that once they come in here and speak, can people stay?
They can,
Okay.
but we will encourage them to leave, especially if there's overflow, but we can't obviously make them leave. I don't.
But they can stay if they wish.
Yeah.
Okay, that's just what if that's the case. That's good.
Sure. All right, looking for a motion and a second so we can vote.
So moved, along with the direction that has been provided in terms of public comment will still be read, but will be provided to the board in advance. All of those things I would, and as long as any changes in the agenda are really being made from a public health standpoint, then I would make that motion.
So moved, or I'll second.
Second.
Already been seconded.
Oh, sorry.
I know I have voted. I'm sure everybody else has, but so far we're not getting the results.
Supervisor Villa-Padua, have you voted?
I'm sorry. I thought it was seconded. So
Always pulling focus.
thank you.
All right, that carries 5-0. That next brings us to discussion item number 2. I appreciate we had this discussion. In light of the feedback I've gotten, and I appreciate that most board members, some in favor and some not, to the 250 or the 100, and in consideration of what many people that are in attendance and our staff have asked that we expedite, I did make a choice as chairman to reduce it to 100 words. We've got a lot of feedback from the public to bring it back up. We've got some feedback to keep it back down. But in light of the discussions, I would just suggest we go back to the 250. I don't know that we don't need a lengthy discussion about it. It was my discretion. I tried it. The public has spoke out. Again, coming from the private sector, trying to be efficient and effective without silencing anybody. And as we even noticed, there's some social platforms that have a 40 or 50 word maximum when you do your tweeting. But I'm perfectly comfortable going back to 250. So that's what we'll do. In light of the fact that our meetings go as long as they do, especially during COVID, I will tell you in advance that we're going to be adding more meetings per month so that we have less time in the span of a day and the span of a meeting, and they're not as exhaustive or don't consume as much time from our directors for that day. So I don't even know, County Council, do we need action at all if, as chair, I decide to bring it back to 250?
I don't believe that you need action on your decision to bring it back to 250. The agenda item, I believe, was brought by Supervisor Wynn, whether or not he believes that there's still a need to have that discussion. He brought the item, so.
Okay. Do we have public comment on this item? Why don't we go with public comment, and then we'll go to Supervisor Wynn if he wants to further discuss this.
Okay, through the chair, the first public comment is submitted by Anne of Manteca, who writes, please overturn Patty's 100-word limit. I sent 249-word email that I'm rewriting to 100. Please commit to 250-word comment available after COVID. Even people who cannot take a Tuesday off to attend meeting can have voice heard. Patty asks and gestures public, staff, and board members to hurry up. One man's bloviation is another man's earnest attempt to talk through the issues on the record. You previously have served on city councils or planning commission, have experienced sometimes painful part of democratic process. Patty, no such democratic experience. Your insight would be helpful. The next comment is submitted by Alex Alaferis, who writes, I urge the board to restore the 250-word limit for public comment. Transparency means reading it out loud. The 100-word limit's free speech. I urge the board to open the chambers to the public again. The next comment is submitted by Sam Regan, who writes, I am writing today to demand the reinstatement of the 250-word limit for public comments. The board's responsibility is to serve the public, yet Tom Patty is trying to reduce one of the very few communication channels the board has with us. The following comment is one of those form comments that I will read once, and it was submitted by Susanna Aguilar, Gabriela Gonzalez, Henry Medina, John Gilgert, Emily Harris, Anthony Avila, Marissa Carpenter, Jordan Jimenez, Kaylee Webb, Christopher Turcotte, Chris Smith, Elizabeth Clark, Cheyenne Hurd, Natalie Peterson, Melissa Figueroa, John McGowan, Orion Camero, Lauren Jennings, Ileana Placencia, Cameron Richtick, Natalie Abran Aves, Clarissa Shane, David Shangthai, Thayer Chum, Victoria Leonardi, Dana Lopez, Alyssa Montanez, Robert Garcia, and Ita Gonzalez. And the comment reads, I am writing today to demand the reinstatement of the 250-word limit for public comments. The decision to modify the comment limitation is an attack on the public's constitutional right to contract their representative. The reasons cited for the change do not constitute the sweeping measures taken, as it is the responsibility of the county supervisors to listen and respond to their constituents. A county supervisor's effectiveness is contingent on their ability to serve the public. The next comment is submitted by Barbara Berrigan-Perea, Executive Director of Restore the Delta, who writes, Supervisor Tom Patty, it's the First Amendment right of Americans to speak freely to address grievances with government. We hold public officials accountable because the decisions you make impact our lives. It's time to open BOS meetings to the public and restore comment times. You've also stated in the community that you're after certain elected officials, women of color, and activists. Our collective has advocated to protect the poor, the sick, the burdened, and the homeless, those who Christ loved most. Silencing us is un-American and doesn't exemplify Christian values you claim. Uphold your oath to the Constitution now. The next comment was submitted by Sam Ellen, who writes, "This land is your land, and this land is my land. From California to the New York Island, from the Redwood Forest to the Gulf Stream waters, this land was made for you and me. As I went walking that ribbon of highway, I saw above me that endless skyway, saw below me that golden valley. This land was made for you and me. As I went walking, I saw a sign there, and on the sign it said, ahem, quote, no trespassing, end quote. But on the other side, it didn't say nothing. That side was made for you and me." The next comment is submitted by Nick, who writes, "As a business agent representing the Comforters Union of America, I understand that time is money. You have highly paid, well-qualified directors sitting in board chambers, although through grueling public comments that blather on. I see where Supervisor Patty is in an attempt to move the process along by limiting the amount of words a person can use during the comment. I know for a fact that anyone can get their point across in less than 100 words. To go to 250 words is a waste of taxpayer money, of which I pay into. I support this proposal 100%. I do have two additional comments that came in. The first one is written by Councilwoman Wormsley, who writes, I am writing you this AM surrounding the 100-word comment. As elected officials, we are the vessel and tools for change. Elected by the people and for the people. The only way we can know, understand, and acknowledge the needs of the people we represent is through constant contact and communication. This can only happen if we open up the lines of communication and not shut them down. Let the community speak, especially during these critical times. Thank you in advance." And the last comment is submitted by Nicole Goring, VP Government and Community Affairs of ABC NorCal, who writes, thank you for having the discussion related to public comment during the Board of Supervisors meetings. Having spoken on behalf of thousands of workers and apprentices in the construction industry at over 150 local government meetings, most of them lengthy and at all hours of the evening, even leading into the early morning, it is important for all voices to be heard. However, out of courtesy for the citizenry and the workforce, it is also a good government practice to create some sense of balance with comments, not only from the public, but from the dais, so as to avoid lengthy meetings. Thank you for your consideration as you look to craft a balanced approach. And Chairman Patty, that concludes the public comments for this item.
Thank you, Madam Clerk. So Supervisor Wynn, would you like to further espouse anything about this issue?
Briefly, I think, first of all, I appreciate your rethinking the process of the number of words for public comment. I guess, and I won't go over my board letter, but a couple of things did concern me and do concern me in regards to what happened here, because I don't know about the other supervisors, but I found out this basically from the memorandum or email from clerk of the board, and then from there I got a call from the record. So my concern is that I hear from our chair in regards to conversations with our county council about authority and the ability to do things. Yes, the rest of the board empowers you to basically run the meetings and to make decisions and sign a lot of documents and make appearances in regards to the county, and I appreciate that because I know how arduous that can be. The other part of it is we are a collaborative body, and before, decisions like this, which obviously, by the way, I didn't talk to any of those individuals, so I have no idea, what prompted them other than the decision itself. But I would say that, things like this really need to be discussed amongst the board members to allow them to weigh in and then make a board decision. So all I'm saying is that hopefully in the future that when you decide to make some of these far-reaching decisions that impact my constituents in my district and obviously the other supervisors, that you have an opportunity to share it with us, so at least we can give some comments. And If you decide to go a different way, that's fine, but at least we've had the conversation. So again, I appreciate your willingness to change it back to 250. And with that, I'll conclude my comments. Thank you.
Out of concern because of the Brown Act violation, I working with our clerk of the board, I introduced the 100-word to give it a trial run so we get feedback from the public and feedback from the board. It's certainly not a dictatorship up here. It's levels of engagement, and I believe I would have been crossing the line with a Brown Act violation if I went to each of you and had a discussion about how you felt about it prior to it being an open board session as it is today and as it was discussed prior.
But so, I don't want to interrupt you, but just to respond to that, that's why I had it on the agenda so we could discuss it as a board. I appreciate the Brown Act, but again, you could have done the same thing and accomplished the same goal, whatever the outcome would be. So again, but thank you.
Excuse me. These halls make my eyes water when I'm wearing a mask. Thank you. I appreciate that. But again, it was something that we tried, introduced. We got feedback from the public in different arenas and different aspects. And I didn't see anybody silenced in their 100 words, but they want more time. And we as a board don't object to that. Then that's exactly the course of action that we'll take. I have no problem with that. So it was something that we tried. Any other comments, or we move on then to item number 4?
I do have a comment on this.
Supervisor Miller, sure.
Thank you. I wanted to say that I was pleased today that Dr. Park's presentation seemed to have gone back to its normal length and a little more in-depth information for us, because there has also been a shortening of presentations to the board. Both the Children and Youth Task Force who had not done a report in over a year to the board, along with the Continuum of Care specifically to talk about this last year's winter shelter issues. Both of them in the past had basically prepared 15 to 20-minute presentations to give the board the information. These are our task forces and folks that we utilize to address a lot of issues, and we also fund an awful lot of their activities.
Supervisor Miller, I would request you to save this for our board discussion afterwards. We're talking about, and Supervisor went in to introduce a 100 or 250 word
but actually
public comment.
It was brought up in the board letter that presentations have been cut. I just want to say, I would hope that going forward, our presentations are based on the information that the board should receive before we deliberate, and not just on, have an arbitrary 10 minutes or whatever. We have speed talkers when that happens.
Sure. Thanks for your feedback. Appreciate that. Moving on now to CAOs. We have a report from a CAO on the 2019 coronavirus-related funding, community impacts related to COVID-19, and fees charged to businesses, and approve related budget adjustments. This will require a 4/5 vote.
I apologize, Chairman Patty. I hate to belabor this, but I did miss a public comment that I did not read that I feel I probably should.
Please share it now.
I apologize. This was submitted by Fritz Groupie, Chairman of the Business Council, who writes, "We are writing regarding the proposed changes to public comments at the Board of Supervisors. We are supporting the return to the 250-word limit and reopening of the board chambers as soon as possible. The most recent policy change to public comment does not support the First Amendment right to freedom of speech, the ability to have access to our supervisors, and displays a lack of transparency and accountability. Thank you for reconsidering this procedural change and continuing to promote freedom of speech and government transparency." And I apologize for the interruption.
That's fine, and I'll reach out to Mr. Groupie and let him know that his message was received, even though it was limited to 100 words. It was concise, it was to the point, and action has already been taken. Mr. Pollan.
Good afternoon, Mr. Chair and board members. Matt Pollan, Assistant County Administrator. So to follow up, this will be the number of items I'll be going through with you and your board over the next several minutes. So after your February 9th board meeting, your board directed our office to follow up on several issues, to talk about all the COVID-related funding that the county received, to identify community impacts due to the COVID pandemic, and talk about fees charged to businesses that could potentially be waived. So in order to accomplish those goals, our office talked to a number of county departments and non-governmental organizations to get feedback. So to summarize the COVID-related funding to county departments, our organization has received a little bit over $295 million total COVID-related funding. More than half of that was the CARES Act, which I know that you're all very familiar with. You can see all the different pieces. These are some of the main highlights that the county used the CARES Act money on. We've also got a number of department-specific pots as well. You can see that $144 million. Public health got $42 million for public health activities. That $29.3 million that we consider in this presentation to our office, that's the emergency rental assistance funds. The airport got direct money from the federal government. Neighborhood preservation got about $12 million for housing-related activities. So a significant amount of money coming into the county for COVID-related topics. But that's not the only pieces of COVID funding, and I wanted just to give you some quick context on other pieces, which I know that you're all generally familiar with, but just to set the stage about the amazing amount of money that's flowing from the federal government, not just to the county, but to the cities and to individuals as well. So I'm sure you're all pretty familiar with the American Rescue Plan. The Biden administration signed that into law the second week of March. Significant individual relief, as you can see up on the screen, to individuals, really generational levels of relief in response to the pandemic. It also includes generational level relief to business sectors as well, as you can see here, all across the board. I mean, even a pot specific to restaurant segment of the economy, transit, airports, all kinds of different segments of the economy getting significant relief through the federal government. And before that, there was a Consolidated Appropriations Act that was signed in December of 2020 with also very substantial aid to individuals and to businesses, as you can see here. And then before that was the CARES Act. So again, generational level, multi-trillion-dollar levels of relief coming to individuals and to businesses coming from the federal government. Now, on top of that, and using some of those same funds and the state using some of its own funds, I listed a number of, I thought, really important pieces here. Again, significant fiscal relief to businesses and to individuals. So what are we here before you today to talk to you about? Is, as we were tasked to do, how could we assist our county in getting back on its feet from the pandemic? As you're all well aware, your board has approved about $17.7 million for small business grants. We're in the process of working our way through the third round of grants. We don't think we're going to have enough money to fund all of the qualifying grants. There are a number of applications that we are rejecting because they're incomplete or don't meet the requirements, but there are a large number that do. We don't think we're going to have enough. So we're asking your board to grant us another $5 million, up to $5 million. If we don't need it, we'll return it to the general fund, but up to $5 million to fully fund all of the qualifying applications for small business grant relief. And again, to refresh your memory, that was up to $25,000 grants to businesses that demonstrated harm from the pandemic. We also did a community needs assessment, reaching out to the nonprofit and community-based organization sectors of the local economy, and what they demonstrated to us was a number of financial related impacts, but they also told us that they did, as I went through very briefly, that they also got COVID related funds, but there was still a net negative impact to these organizations. We recommend covering that gap, which is $2.9 million, to a number of organizations. For instance, just to give you highlights of kind of some of the major ones, they include Goodwill, Mary Magdalene, the Family Resource and Referral Center, San Joaquin Child Abuse Council, and AspireNet are some of the larger organizations with the most significant gaps that were identified through our work with them. And when it comes to this segment, we would definitely, we had a survey, as we indicating that need. We would follow up with those organizations, verify the facts in that case before we would approve final allocations. And then there are also some other pieces that we followed up on to that affect the regional economy and the regional populace from the pandemic that we wanted to focus on too. So services to children's ages 0 through 5, childcare, and food banks. So on services to children aged 1 through 5, we recommend that your board appropriate $2 million to the Children and Families First Commission to continue the good work that they're doing. There's a number of programs that they would like to augment and to continue to the community. You can see oral health outreach to underserved communities, supports for families of kids at risk of being developmentally delayed, and a number of other topics there that the commission believes that it could continue to do its good work. On childcare is a really big issue as the economy is getting ready to open back up. As a matter of fact, as we were sitting here, I don't know if any of you saw it, the governor announced this morning that on June the 15th, they're going to do away with the tier system. Assuming that we have enough vaccinations and that hospitalizations are low, that the tier system is going to go away and the economy is going to open back up. The state's going to continue to encourage mask wearing and the distancing and doing certain things, but the tier system is going to go away and the economy can reopen. As that happens, parents that are returning to the workplace are going to need to find childcare. Childcare was tough to find even before the pandemic, but the pandemic has exacerbated that dynamic. So we believe that providing a stipend, the Family Resource and Referral Center also agrees that providing a stipend to child care providers would really help them and bolster that child care capacity in the community for when these parents return back to the workplace. A bunch of child care providers shut down because of the pandemic, and that'd be great to get them and encourage them back into business. And the center indicated it's also had administered stipends before from the state and from the city of Stockton. Food banks, we all know that there's a great deal of demand and increased demand for food banks across the county. We've heard from a lot of them that their constituents and the demands, it's up to 50%, 30% increases. So we have a questionnaire that we filled out, we've drafted, we haven't sent it out to all of these. These are probably the majority of the organizations that we would reach out to get a sense as to what they could do. They may also have some of the ones that we've talked to also indicated a need for infrastructure, increased refrigeration capacity, those kinds of things to handle the volumes that they're seeing. So we're asking your board for $2 million, up to $2 million to reach out to these organizations and to allocate to them to meet that really increased need for food in the community. Your board also asked this office to look at fees for businesses and what fee relief we could provide to businesses. So we talked quite a bit with our sister departments in the county, and we want your authority to continue those discussions predominantly with environmental health and the treasurer tax collector. As a matter of fact, we've been talking quite a bit with environmental health over the last couple days, and it's kind of interesting that there haven't been a lot of businesses knocking on their doors asking for fee waivers or fees to be rolled over from one year to the next, but we would want to continue those discussions to make sure that if we were going to waive fees, and that 3.7 million figure that you see up on your slide is the total universe. If we uniformly waived all fees, that would cost the county. That's not what we're recommending. We just want to continue those discussions with environmental health to target any needed fee relief where it would really have bang for the buck. So what are the next steps? So we have a number of recommendations in front of you. I can read those off if I need to. If not, we can I'll stop the presentation and take questions. But I also had one more slide after that too, just on next steps. On top of that, on top of the recommendations was just, I know that a lot of people are very interested in the Rescue Plan Act. Assuming whatever authority you give our office today, we'll follow up immediately on that and get those actions going. We'll continue discussions with service providers really leading up to the 21-22 budget to understand what's going on. I just wanted to give your board with all those different federal appropriations bills and the breaking news from the governor today, there's just so much going on so quickly that it's hard to really have a good sense, a data-driven sense as to what's going on in the economy. In particular, this pandemic-driven recession has been so uneven and so unlike any other in recent history. We want to make sure that we're making good, sound, targeted decisions and directing help where help is needed. So really we're anticipating the 21-22 budget will lay out a more comprehensive plan for you. So I'll go back to the recommendations and open it up for any questions.
Thank you, Mr. Paulin. Questions? Supervisor Rickman.
Thank you, Chair. Looking at the report, now the report doesn't explain how the questionnaire determined that the nonprofit community had experienced approximately 6.5 million impacts related to the pandemic. Can you?
Sure, I can elaborate a little bit on what we asked. So we had polled and sent out a form to these organizations asking them if they had what kind of financial impacts, whether it was revenue impact, whether they incurred increased costs, those kinds of things, similar to what we've done with the small businesses. So they could have incurred losses or harm one way or the other. And again, we also asked them if they had received any COVID-related funding. And for those that did, we indicated a net need, which is what's before your board today, of that 2.9 million.
Now, do we know with that what services they're going to provide with that money?
It's a whole host of, depending on the organization, it's a whole host of different services.
Okay, what about the latest federal funding, the American Rescue Plan Act of 2021, and they indicated nonprofits are eligible to apply for funding. Do we know if funding was given to our nonprofits, another avenue for them to get funding also?
I do not know of a specific pot in the rescue plan that could provide relief to nonprofits, but certainly a possibility given how much money was in that bill and how many different areas could potentially get relief.
All right.
Supervisor Rickman, through the chair, one of the things I want to caution about, and we ran into this last time with the CARES money, is we want to wait until the Treasury guidelines start coming out so we make sure that our expenditures are in alignment with the guidelines. And then what we've been doing is we've been roping in our audit partner from Eide Bailey in order to, because they're going to do the audit after we do the expenditures. As a matter of fact, they're doing that now with the CARES money. And we want to make sure that as we move forward, we're doing things that we know are going to be compliant all the way through the process. So we'll be getting, I think, our first tranche, Matt, is that in May?
Correct.
And we'll have probably a better idea as the weeks start to unwind, and we'll be happy to keep you all posted.
Yeah, we're just looking at, all avenues of funding. Our nonprofits, we have some great nonprofits here. On that February 9th report, this is a little bit different than what I asked for. As referenced in the February 9th, in the minutes, I asked for an economic report that would consider the numerous, the Worker Adjustment and Retaining Notification Act, the WARN Act, the notifications, how many we received on that, and businesses that are reorganizing or going out of businesses here in San Joaquin County, and property that may be foreclosed on, and the many other impacts that our economy that will be realized in the future here as a result of this pandemic. And, I expected to hear reports from our Employment and Economic Development Department, our Economic Development Association, the San Joaquin County Partnership, County Administrative Office on Grants, the UOP Center for Business and Policy Research, which I'll touch upon, our Chambers of Commerce, and the State Employment Development. As you can see, more of a macro side. And once we got word that this report was coming out, it was incomplete for what I asked. I'm also the chair of the mega region for COG, and the University of Pacific came out with a mega region economic performance and connections, and this was on March 26th, and it gives a macro of the mega region. It also includes San Joaquin County. But some of the concerns that I have here is you can see it in percentage change of employment, for example. In San Joaquin County, as of November 15th, 2020, employment rates decreased by 6.6 compared to January 2020. Economic impact analysis, change in employment, percent change in small business revenue in San Joaquin County as of January 30th, 2021. Total small business revenue decreased by 18.4% compared to January 2020. And if you look at the hospitality, for example, and I won't go through all of this, but we've taken a huge, I think that's the biggest industry that has been hit since the pandemic is hospitality. I want to say a decrease of, and don't quote me on this, but minus 21%. And, what does that have effect on San Joaquin County? And as a county, what can we do to, prop that back up? So there's a lot of different things that I think in order for us to make policy change, and mostly when we're having a budget coming up here, and how we can assist our small businesses and our economy. For example, if I recall correctly, I'm just going off memory here, and they're talking about small businesses, 30%, I believe it was, that are gone, that won't be returning. And, how are we going to deal with that on a macro level? And then, for example, hitting on that topic, many small businesses have likely closed permanently. This is from the Economic Mega Regional Report. And percentage change in number of small businesses open. And it goes down to say, for example, Sacramento is minus 32%. Across the whole entire country, 32%. San Jose is minus 40. San Francisco is minus 49.9. So those are those numbers that I want to look at and get more of a micro here in San Joaquin County and what we can do going forward, especially when the budget is near. And I think that's information that we had to have. And I've asked for this since February, and I thought I made myself pretty clear. And this mega region report is on, I believe, the COG website, and I believe we have a copy of that. We can forward it to the rest of the board also to look at. So with that being said, I'll go ahead and yield my time.
Thank you, Supervisor Rickman. Supervisor Wynn or Supervisor Miller, my cue doesn't work if anybody's asking to speak.
Real quick, in regards to the transfers, when you talk about moving out of the general fund, are we talking about the amount of money we received through various federal grants, like the CARES Act, et cetera, which replaced our existing general fund expenditures for operation, et cetera? So instead of spending, for example, let's say $90 million on what we would normally pay for those type of operations, because of COVID, we got $90 million that came in and replaced that. So we had the $90 million that we had set aside in our budget is now, lack of a better term, a surplus. Is that what we're talking about, general fund money, or out of the existing general fund that we've budgeted year to year, as Supervisor Rickman talks about?
So it's a combination of those things. Certainly, Supervisor Wynn, as we reported at our mid-year report, the CARES Act funds that offset other expenditures increased our general fund reserves. We had general fund reserves in addition to those expenditures that were freed up through the CARES Act, but as a combination of those things, as our office reported at mid-year, we have pretty substantial reserves, due in part to the CARES Act funds.
Okay, so I guess my question would be, and I would assume our CEO would well, you probably know, you deal with the budget. So do we know, for example, based upon our budget that we passed for this fiscal year up to June 30th, we had set aside a certain amount of contingency or reserve, whatever you want to call it, and then we got this infusion of grant money through CARES Act and soon the American Rescue Plan, those types of things. So I guess my question is, are we maintaining our budgetary discipline in regards to what we passed and setting aside that extra money that we've received, which is, as you call, a surplus, and are we spending these grant monies out of this surplus as opposed to about our existing general fund budget, which was passed by this board back in June of last year?
So we are sticking to our reserve targets. That's absolutely the case. We have reserves in general. I'll characterize it because, as you're probably aware, we have different reserve buckets with different names and different labels. But absolutely, we have reserves above and beyond those which your board approved as part of its current year budget. We have reserves available above and beyond that.
Okay, well, my concern is we're not dipping into our general fund budget reserves for these programs. This is extra money that we received through the federal government or the state government, et cetera.
Basically, that's correct.
Okay, good. Thank you.
Supervisor Miller.
Thank you. So this additional $5 million for small business grants, that's basically to provide enough complete funding for round 3, which is already closed, correct?
Correct.
And so the closing date on that was January 31st?
I believe the end of January, yes.
Okay, and so is there going to be, in this next tranche of money, is there going to be, because I know a lot of businesses, even though they could project forward, they weren't 100% certain when they'd be able to reopen, so they only submitted for reimbursement for expenses up through, say, December or even January. So is there going to be another round of small business grants that maybe are going to provide additional support for these small businesses?
Well, I think that's something definitely for us to consider, for our office definitely to consider as part of the 21-22 budget. And again, it's tough to see. You make a good point about the timing of the need, but just given all of those different sums of money that are going to small business, I think it'd behoove us just to make sure that we take a deep breath and kind of really understand what's going on before we take those additional steps. Our office, if we see that there's a continued need out there, we'll definitely deliberate upon that and bring that back to your board for consideration.
Okay, I think that's great, and I think it's fine to, make sure that we're utilizing what's already been allocated. But we heard today we're just going into the red tier now, and it's April, so there's at least a 90-day gap. And for a lot of these businesses, it's going to take them a while to ramp back up, especially in the hospitality industry. And so I just want to make sure that it stays on the radar screen. We have a lot of businesses that, first of all, they submitted for round 3, and I had a small business owner in tears yesterday when I told her, well, we found your application, you have been approved, gave her the amount. She was in tears. She was so grateful. So it truly is a lifeline to small businesses, but I want to make sure that we keep this on our radar screen because a lot of them cut off, and that was direct reimbursement. It was very specific what you could get reimbursed for. So I want to make sure if there's any additional support we can be providing for these small businesses, that would be fantastic because it doesn't just help them, it helps their landlords, and it helps the surrounding businesses around them as they come back to life. And then the last thing is, I want to thank you and staff for being so responsive and really digging in and looking at some of these needs that have most impacted our children and our families, especially our lowest income families. But for a lot of these families, when we talk about helping the food distribution, there are thousands of families that are in food lines now that have never, ever had to receive food before. And so I just want to thank you for being so responsive on that. That $6 million will be, I think, will be really helpful and go a long way to when we heard the terrible price that so many of our children are paying. The more we can shore up that safety net, please keep that. Again, stay in close contact with our HSA folks because they hear from our community organizations all the time about not just where their funding gaps have been, but where their needs have gone up. So it's been a double whammy. They've lost volunteers, they've lost outside funding sources, but then they've had an even greater demand for their services. So I would just encourage you in those two areas to please keep that on the radar screen and get it back to this board in as quickly as possible so that we can be ready when that additional funding shows up. Thank you.
A quick follow-up from my position here. I know that we've had some members in the Sikh and Punjabi community that are feeding those in the community that were unable to provide for themselves during the shutdown. And I know they submitted for reimbursement, and this is a faith-based organization giving hundreds of meals a day and large outreach of food. They've even recently went to the hospital and on their own good free will and gave food to hundreds of people just as an appreciation. So not everything that they're doing are they asking for reimbursement, but perhaps you can send to me whatever mechanism it is that I can send to them a submission and request for consideration. To the best of my knowledge, months ago they submitted and they were denied, even though they're giving out boxes of food and serving those in the community that are unable to provide for themselves. So send to me again an email and I'll forward it to them so they can once again submit. Secondly, as it relates to fees and waivers, waiving any fees for environmental health, I know the business licenses are only $100. That's pretty marginal. And you noted the number was 3-point-something million annually. I'd like to see us pare that down to businesses that were in the purple tier for a multitude of months and a year plus, as we know the impact has been. And whatever those fees that are associated with those businesses that were impacted, that 1,000, 2,800, 900, 1,200, whatever it can be in the spectrum, we need to really address that and give them consideration. So I'd like to pare that down and bring back to the board some measurable actions, whether it be a refund or a waiver of this year's fees. I don't know when the fees were due by, but I think that that's an impacted element of our economy and service providers that could use a little bit of relief during, even if in the red tier businesses are only allowed 25% interior seating. That doesn't really do a lot for a restaurant. So there's still impact for them, and they're surviving from last year, having paid those fees, as you pointed out, Mr. Pollan. They paid those fees last year, and just months into it, during the year, the businesses were severely restricted and limited. So I'd like to see that come back to the board. How much time do you think it would take to drill down a little bit into that into those fees for those sectors?
Oh, I think that if we really sat down and talked to environmental health, and they're here, by the way, if you or your board members have questions for them, that we could figure out which segments really need the relief pretty quickly.
And I think we can identify, much as we did with RAD, if you had a drive-through business, we know that went up. If you're a large corporation, we're not dealing with impacts as similar to what the local businesses and independent operators would.
And that's absolutely who we would want to be targeting, are small businesses definitely harmed by the pandemic in some way. Yep.
Excellent. Yeah, thanks. And again, bring something back to the board for our consideration, and that would be, I think, time and money well spent and reallocated. We are not actionable on this at all, are we?
Chair.
Supervisor Miller.
I believe we are, but I have
yes.
I have one more quick question for Mr. Pollan. On the statistic in regards to childcare, that 100 out of 830 some have gone out of business. I actually met with a group of childcare providers, and one of the things they specifically mentioned were the startup costs to get back in business. If we could take a look at that, I have a feeling some of those costs may be state related, and if that's the case, that may be something that we want to address under our legislative platform, and maybe have our chair send a letter to our state representatives in terms of taking a look at how can we streamline the process to get the various licenses that are required to either get our child care providers back in business or perhaps get some new businesses up and running. There's going to be a terrible need for child care providers. And, it's great to have stipends, but they only work if you've got providers. So that may be something that we can look at as well, both local fees and at the state level. That may be more of an advocacy issue for us.
We'll note it and look into that.
Great. Thank you so much.
Excellent. And Madam Clerk, do we have any comments from the public on this?
Thank you, Chairman Patty. We do have one public comment that I'll read. It's from Christina Gilbert, Director of San Joaquin Children's Alliance, who writes, On behalf of the Children's Alliance and members of the Children's and Youth Task Force, we wanted to acknowledge the work that has been done by the CAO's office and community partners to bring proposals to you today to help mitigate impacts from COVID-19 to children and their families. We appreciate your consideration today of the realities of these impacts and the long-term repercussions we will all face if we do not act now. These investments are a good start. We hope to see ongoing collaborations as we have much work to do. And Chairman Patty, that concludes our public comments for that item.
Okay, thank you. And barring any further comment, then I'm going to need a motion.
I just have a real quick one. I have a real quick one, if you don't mind. So we need to develop an economic recovery plan, and with that, we need to know where we stand currently. And that's what I mentioned on February 9th also. So my advice to you is to go look, I don't know who I'm talking to here, but is to look at that UOP study. And, you know, and that's a place to start. And, you know, what businesses need relief. I mean, just another example is spending at small businesses and percent change in small businesses revenue. What is it here in San Joaquin County? I know in other counties it actually went down during the pandemic, which we all, even with, you know, all the PSAs and shop local. So they need help. And in order to have that, get that recovery plan pushed forward, we need to know the information. So if you have any questions for me on that portion of it, so we don't run into this again when it comes back to the board.
And Supervisor Rickman, I think that's some of the things that I was alluding to in my presentation about that's avenues that we're going to pursue and information. Thanks for making us aware of that UOP presentation. It's unfortunate that the Center for Business doesn't do its quarterly economic report any longer. That was really the only truly local source of regional economic data that existed, and they don't do it any longer because of fiscal considerations. But we're definitely going to be looking into those kinds of things when we leading up into the 21-22 budget, for sure.
All right, thank you. Yeah, because these small businesses, you know, mom and pop shop, they need help, and they need help now. So thank you.
Agreed. CAO Wilverdeen, did you have a comment?
Thank you, Chair. Yeah, I just wanted to follow up with Supervisor Rickman's request. The economic development plan that he had mentioned came to my attention last week, my first week here. And I've taken a look at it, and it was my understanding that my office would be working through your Chief of Staff to get more of a handle on what it is you were talking about. I wasn't aware it was something you were looking for this meeting. I also have some thoughts and suggestions I'd be interested in sharing along with you, so I'd like to do that to set that up.
Yeah, please. Thank you very much.
You bet.
Okay, thank you. And barring any further discussion, we need a motion. And
I would move to approve this as presented by staff.
A second.
Second, please vote. Fantastic. 5-0. This moves on. Thank you very much. Next on our agenda, are we actually at consent? I believe we are. Anybody like to pull any items on consent? Not seeing any.
Chair, real quick, I just have a real quick question. Item 5.12.
Item 5 you like to pull?
Yeah.
Okay.
I just have a quick question.
Just a moment. We'll get to it in a second. Anybody else? Okay. I'm going to pull item number 9, and I believe it's 12. Yes, item 9 and 12 for discussion. So moving to item number 5, we have approve the announcement of the position of one Children's and Families Commission. No, that's...
No, it's the authorized Director of Child Support Service to sign the federal fiscal year 2021 plan. It's 5.12.
I have a different number. Okay.
I just have I don't need a report. I just have a question if Director Lori Cruz, if she's...
Yes, Director Cruz is here.
This is just real quick.
Good afternoon, Chair, members of the board.
Good afternoon. Just a real quick question. I know we've been battling over our fair share with the state. Where are we at on that?
Well, we do have some good news on that front. In the governor's January budget, $24.9 million was allocated to local child support agencies, and a fair portion of that would be allocated by the State Department to historically underfunded child support agencies, which we are one. We also have news that potentially in the governor's May revise, that number of $24.9 million may be revised to be $56 million to allocate it to, again, the historically underfunded child support agencies, of which we are one.
No, that's great. That's just a question I had, so thank you very much for that.
Actually, Director Cruz, while you're here, that's exactly why I had called your office and was hoping that you would be able to just share a little bit of light. I know that I believe it's item number 12 is also going through your department.
Yes, sir.
And just wanted to get a snapshot of what was going on in your universe. I know that as we've recognized our child abuse month of child abuse awareness, and know that you and your staff are working diligently on behalf of families and children. So perhaps give us an idea of some of these use of funds and a little update on what's going on in your department.
Well, certainly, and I appreciate the opportunity to provide the information and the question. As all the departments, the last year has been very challenging for child support services. I am very pleased, though, that despite those challenges, the department has been able to continue to provide services like most county departments. We didn't shut down a single day, and we have found innovations to provide services that weren't available before. We now provide much more reliance on services where people can contact us online. During that same time period, we brought our calls back from the Butte County Call Center, so we are now handling all of our customer calls in our own customer contact center, and we are having great success handling our customer questions and also taking payments via the call center. The office also opened a satellite office at the Tracy WorkNet office, so we have a presence now in the South County where we've never had a presence before. Consequently, we've also taken advantage of telework options for county employees. That's provided a great benefit for child support professionals in that, just as you were talking about child care options, we have so many employees in our office who have young children, and because of child care and because of distance learning, it's practically impossible to work a full work day, 8 hours, and still take care of your children. I can't imagine being a working parent myself these days, given all the challenges. So teleworking has been a fantastic option for our employees. And along with the funding issues, we have continued to be visible and aggressive in the project of pursuing appropriate funding for our county. And the state has been a ready partner in terms of making sure that they follow the allocation methodology that this county pursued many years ago, and also ensuring that that budget not only is fair, but it's also transparent.
Outstanding. And that's all?
Without a ready presentation, that's what I can think of at the moment.
Well, fantastic, and thank you. I know that we've had challenges at the state level, as Supervisor Rickman asked you to share. So I know that you and your staff have been very diligent in not only the continuity, but raising the bar and bringing attention to some of the greater needs in our San Joaquin County. So thank you and appreciate that. I don't know if any of the staff has, any other board member has something to say, but I thank you, and that's why I wanted to kind of pull that up and get an update. Thank you much. Next, I have pulled, I wanted to get through our CAO on item number 9, retroactive approval of the increase for the amount of the consulting services agreement with Alston and Bird. I'd like to just pull this for a comment from our CAO's office.
Thank you, Chair. I just wanted to mention something from the presentation that was made from Alston and Bird back in February, and I know we're now working on the non-binding LOI, and I am a member and have been in my former role as Auditor Controller at the Healthcare Services Committee. One of the things that we're looking at, and I think we've discussed this, and Mr. Culberson can probably discuss it even better than I can, is we're looking at 3 different partnership arrangements: a sale, a long-term lease, and a management services agreement. And what I would suggest is, as we go back and we make this retroactive approval, because this is a fair amount of money involved here, is that what would the estimated economic value of each one of those transactions look like? And that's what I would hope to see as we move forward through this LOI. In the year and a half that we've been moving in this path, we've not seen any economic numbers. I have not, as to what any one of these three options might look like. And I think it would be wise for us to maybe incorporate that in our criteria as we move forward with Alston Bird, so we don't wind up halfway between here and June, when I believe this is supposed to conclude, and not have a good idea of what we might be getting in each one of these three pathways that we're looking at. Understood. Appreciate that. Dr. Culberson, thank you. I'm glad you're CEO of our hospital. Is Alston Bird an organization that does this type of work? I know we've engaged with them, and they've done basically a lot of analysis and engagement with different parties to kind of pare down where the county would go, as we have chosen to do. But going to the next level, when it starts to look at numbers and going through what would be the different possibilities, is this something that's within their wheelhouse, or are they more transactional and utilized for, dotting I's, crossing T's, and finalizing the paperwork?
Chair Patty, yes, you're correct. Alston & Bird really is the strategy and then the paperwork transactional side of things. We have been working with Alvarez and Marsal, however, who have this kind of quantitative skill that will be able to answer the questions of the value of each of the three options. And we do have an existing arrangement with them, with Alvarez and Marsal. I'll have to make sure that we work within the guidelines of county purchasing, and if necessary, bring back a contract for your board's approval. But that is their skill set, is that quantification of value.
Okay, so then would we actually engage with Alston?
Alvarez and Marsal, we would need to do both. I'm sorry, if I could.
Yeah, no. Well, do the two meld together, or do we let the Alvarez group do what they need to do now, and then we bring it back to the Alston group for finalizing and completing the agreement?
Chair Patty, I would recommend that we do that simultaneously. We have been working with Alvarez and Marsal on some of the nuts and bolts of putting together the work streams. That was really a lot of the work that they were putting together, but they do have a valuation group that would be able to, I'm sure, be able to be engaged to do this work. I'd recommend that we do it simultaneously as we continue our work and development of not just the letter of intent, the non-binding letter of intent, but also the other components, such as what the structures would look like. Because really what we're asking here is you take a look at the structures and then look at the value of the structures. And I think we would engage Alston and Bird to do the technical side, some of the engagement with the really taking a look at what the transaction side would be. At the same time, then we'd have Alvarez and Marsal doing the quantification of the values.
All right, my concern is we've spent a lot of money with Alston and Bird, and we're not close to finalizing anything. We're actually at the beginning stages. We've pared down who our dance partner would be, so to speak. But if we're going to, I'd be very cautious as to why we're engaging with Alston and Bird if they're transactional when it's the Alvarez and Marsal group that needs to step in and give us evaluations. Are they also negotiators for us, or they just present numbers?
No, they would be presenting numbers. That when we got together with Alvarez and Marsal, starting back probably in November, that was clearly one of the things that their skill set is much better than the consultant Larry Gage, who's really done the transactional side. He's done a lot of the work on antitrust. His firm does a good evaluation. Remember, his work was really doing the assessment of the work streams and who would do the best for the county and best for county residents and best for San Joaquin General Hospital.
Okay, so Alvarez and Marsal will present numbers to the Gage group, Larry and company, to the Alston and Bird group.
Yes, that's correct. To the Healthcare Services Review Project Subcommittee, yes, that's correct.
Okay, and how did we choose Alvarez and Marsal?
It was a recommendation of Larry Gage from Alston and Bird.
Okay, got it. Thank you. CAO, I appreciate your approach and the dialogue you're going to have. Make sure that we're coming together in the proper channels. Okay, seeing nothing further from anybody else, thank you for your time. Appreciate it. All right, I believe that's the end of any discussion item on consent. We'll need a motion to approve our consent items.
So moved.
Second.
We have a first and a second. Please vote. We have passed 5-0. Thank you all very much and appreciate everybody and staff that waited patiently. Next, we are at discussion items, general government. Our first item is oral presentation on available vacant county land. Is that correct?
Chairman Petty, actually, first we have a scheduled morning item on page 9 of the outline.
Okay.
So public hearing.
Yep, I missed that page. So we are here with a public hearing to consider the Planning Commission's recommendations to approve development title text amendment number PA 210015 to amend the commercial cannabis chapter 9-1090 of the development title.
Good morning. Afternoon.
Good afternoon.
Chairman and members of the board, David Kwong, your Community Development Director. I'm going to actually ask my Deputy Director of Planning, Jennifer Jolly, and Stephanie Stowers, our Senior Planner, to present it. And just before I hand it over to them, this is really a cleanup ordinance, and they're going to go through those specific details of that particular cleanup ordinance. It really parallels what you're going to see as what you just approved in terms of Title IV changes on consent, and really this is on a public hearing because all Title IX amendments or ordinance amendments need to go through a public hearing. So with that, I'm going to hand it over to Jennifer.
Thank you, Mr. Kwong. Good afternoon. We have a very short presentation for you. This is Stephanie Stowers. She's our senior planner and has processed this text amendment, so I'll turn it over to her.
Fantastic. Thank you.
Good afternoon, Chair and Supervisor. So this project is a text amendment to modify various sections of the development title, specifically the commercial cannabis ordinance, to provide clarification regarding commercial cannabis development agreements and ensure consistency between the development title and Title IV, which contains the licensing requirements for commercial cannabis operations. If approved, the proposed amendment will be applicable countywide. Specifically, the proposed amendment will result in 3 modifications. First, the amendment will clarify that commercial cannabis development agreements are only between the county and the developer of a commercial cannabis operation. Although it was the intent of the original text, as projects have moved through the entitlement process, applicants have noted that the existing text is unclear as to if the original applicant as well as future tenants are required to enter into the development agreements. This clarification will ensure developers that the terms of the commercial cannabis development agreement will be set during the project approval and will not be modified by future tenants, providing certainty of the terms when marketing their facility to their tenants. Second, because the commercial cannabis development agreement is between the county and the developer, which we clarified above, the existing text does not ensure that the tenants under the developer are aware and are subject to the conditions of approval as well as the development agreement for commercial cannabis. So as a result, the proposed text also includes the addition of an agreement, a commercial cannabis licensee agreement, which is between developers and the tenants and binds the tenants to the terms of the development agreement, as well as the conditions of approval for the operation. As the director stated, Title IV amendments to clarify these development agreement requirements were also proposed, and those were included on the consent calendar today. Finally, the proposed text clarifies through the development title that all retail permitted must be non-storefront, delivery-based retail only. This provides additional consistency with Title IV, which was updated in 2019 to include this prohibition. Because of the Title IV prohibition, no storefront-based retail was permitted. However, this modification will further clarify that non-storefront delivery retail operations are permitted. These amendments combine to bring clarification and consistency to the commercial cannabis ordinance, however, maintain the intent that the original ordinance was adopted. So it is recommended that the Board of Supervisors approve the development title text amendment number PA 21000015 based on the ability to make the required basis for development title text amendment. Thank you.
Fantastic, thank you. Any questions from staff? From supervisors, please. Supervisor Wynn.
Currently, how many applications do we have for these type of operations? How many applications?
Through the chair, I would approximate that we've received about 10 applications since the adoption of the ordinance. However, we only currently have about 3 that are moving forward with their application.
Do you know where they are?
Where the location of the different,
right.
Yes. 2 are actually scheduled for the next Planning Commission hearing on April 15th, and 1 is in Lockford on Lock Road, and the other one is in the unincorporated urban community of Stockton on Report Avenue. That's the second one. Those are the 2 that are going to the Planning Commission next. And then we have another one that is moving forward, and it is located along a frontage road in the north part of the county in Acampo. They're in the very, very early stages of moving forward with that project. We're still reviewing it.
Okay, and you've had others that are started and haven't fulfilled the application process.
That's correct.
That's my concern, because I think Mr. Wong will probably, Director Wong will probably be in a meeting Thursday in Lockford over that particular issue. So unfortunately, the board passes this, but they end up, for the most part, in my district. So that's my opposition, because we've talked about this for years, so I'll just leave it at that. Thank you.
I'd like to state that the public hearing is now open. Madam Clerk, is there any public comments on this?
Thank you, Chairman Patty. No, we do not have any public comments for this item.
Okay, then we'll close this public hearing and bring it back to the board for a motion and approval.
I'll make a motion to approve.
Second.
We have a motion and a second. Please vote. This passes 4-1. Thank you very much.
Thank you.
Now we're going on to our discussion item number 1, oral presentation on available vacant county-owned land. Dr. Cunningham.
Good afternoon, Chair, Supervisors, Council, CAO. Marcia Cunningham, Director of General Services. We're here this afternoon to present the findings of available vacant land. Let me begin with some background. On January 26, 2021, the board requested General Services Department to provide a report on vacant county-owned land to be used as a potential development location. General Services work collaboratively with the Assessor's Department and Public Works Department to gather the information. We appreciate the assistance from these departments and thank them for their help. The search criteria parameters, we looked for properties that were over 5 square acres located throughout San Joaquin County and currently have no designated plans. Factors not researched were the zoning change implications, phase 1 and 2 environmental site assessments, and then physical inspection of the properties. With me today is Eric Fallon. He's here and he will go over and present the properties from our findings.
Thank you, Marcia. Good afternoon, everyone. For this search, we filtered with vacant county land and miscellaneous county property use codes. And what the system generated was 100+ APNs representing vacant parcels spread out across the county. With the help of many, we looked into each one. Most were eliminated because of how small they are. others because they're a part of a county service area, some because they are parks, and many because they are landfills or storm drainage basins. While our efforts show the county doesn't have a lot of usable or buildable land, we did zero in on a few parcels that may be of interest to this board. I'm looking now at the findings slide you see before you. You can see there are essentially two areas where we identified possibilities without planned usage. First, in Lodi, at North Lower Sacramento Road, there are about 7 acres available, and an additional 1 acre separated but very close in proximity. Next, in French Camp, just east of the 5 freeway at West Hospital Road, are 2 larger parcels identified by the same APN. One of the 2 is 17 acres, the other 8 acres. Slide 5 provides us the best visual of what we're working with in Lodi. 1 parcel in purple and a connected parcel in green for approximately 7 total acres. Slide 6 is that separate 1 acre parcel in Lodi I mentioned. It's in the same general area, a bit south of the other 2 we were just looking at. Finally, slide 7 helps you get an idea of the 2 parcels I spoke of in French Camp. The 17 acre parcel represented in purple and the 8 acre parcel in green. You likely know the area and that the red portion of the parcel west of the 5 freeway already includes many county facilities. Again, I want to thank everyone who pitched in on this effort, especially Mr. Timothy Brand in the assessor's office. The limited results might cause one to think this was pulled together quickly, but that wasn't the case. That said, thank you. I certainly hope it helps, and we'll open it up for questions.
Thank you, Mr. Fallon. Quick question for you. You showed a 1 acre piece of land in Lodi, but you said the criteria you were looking at was 5 acres and above is for what I'm looking at. Was there smaller acres that we didn't identify or utilize that would have fit into the search?
A few, Supervisor Patty. That very question came up in our preparation for this presentation, and it was decided to include that one because it was so close in proximity to the other 2 in Lodi.
Understood. Okay. Just to share with the board, I had asked Director Cunningham to look into this during one of the recent CSAC meetings. It was being discussed that while we know San Joaquin County is 44,000 doors short of current supply and demand, we've got a shortage of veterans housing, we have a shortage of low-income housing, we have a shortage across the spectrum of what's needed. So I was in the CSAC, a couple of counties have utilized and looked at land that they had, and they were making it available free of cost to developers to come up with a proposal and lessening that startup cost, getting the wheels moving so that there's not so much of a burden to get a project off the ground and to even get it completed. So I thought to take a look, and I appreciate Director Cunningham and staff and the time put into it with different bodies of services here. But I wanted to bring it to the board and see if this is something we want to further ask, maybe to bring back a proposal for the board to consider and utilize this land that might be suitable for some sort of development, whether it be low-income apartment complex or whether it be expanded veterans housing programs that some developer may be interested in doing in conjunction and in partnership. The exact details of how it works would be something that staff would filter and bring back to us for consideration. So with that said, what would be the pleasure of the board to further explore this and possibly smaller acres of land? 2 acres could be quite suitable for apartments or duplexes that might fit into that criteria. I don't know. I'm not a developer. I don't know how much land they would need. But if there is land that would be suitable for residential or apartment complex development, I think we should also consider that. So what would be the pleasure of the board to further explore this? Supervisor Villaputo, are you in favor? French Camp is your district as well. There's a couple of pieces of land there.
Yeah, I'd like to support more.
Okay. Supervisor Rickman.
Yeah, I think we should bring it back.
Okay. Supervisor Wynn.
Well, I'm willing to look at it. I can tell you right now, I know, at least in Lodi, I know what the reaction would probably be, but nonetheless, we can look at it and see where it goes.
Yeah, and every piece of land may not be suitable. We're seeing agriculture versus, there's different categories, but I just, again, thought it might be helpful for us to consider, and it seemed to be helpful to jumpstart some projects in other counties worthwhile for us to consider here. Supervisor Miller.
Yeah, I'm not opposed to exploring this. This is actually what the county contributed, or a good portion of what the county contributed toward Victory Gardens was the land. In that particular case, it was a lease, but still, there's so many other things that weren't considered in this. As you said, zoning wasn't looked at, infrastructure, services, none of those things were looked at. And in both of the cases of the properties that you brought back, I don't believe there are any services there. So this is very preliminary, but I don't have a problem with looking at it. We know there's a shortage of affordable housing in our county, and if land is something that the county can kick in to make a project work, I have no problems at all with the county doing that.
Excellent.
Again,
So I think you're getting some pretty good direction, and I know that in the conversations prior, we did talk about what would be suitable possibilities for some development, housing development or such. So, and I spoke with Mr. Balaji. He looked at the list, and there are possibilities, at least one or two, that we could consider and bring to the board. So let's go there. I think you got a little direction from the board. Each board member can perhaps filter to you and ideas of how it might be. I know that what I've seen, just to float out there, ideas and parameters that might work, is that you're gifting this temporarily. If a developer developed it and sold it right away, then the county would get paid, including maybe suspending the fees, the startup fees now, but they would be due later upon the transaction of a sale. We certainly don't want to bring this in at a basement, startup cost. Somebody flips it, makes a bigger profit, and we were kind of, taken advantage of for what the ulterior goal would be. And to Supervisor Miller's point, I believe Victory Gardens, we had spoke, and there's a potential for a phase 2. So I know that's also a follow-up conversation with Mr. Ragsdale. But anything we can do to expedite that and make it available, let's explore that as well. So I appreciate it. Thank you for the presentations. Director Cunningham.
Yeah, I'd like some clarification on the direction and what the board's looking for from General Services at this point.
Sure. So from this moment forward, identifying the land perhaps as you have, and opening up to what would be a couple acres, 2, 3, you might have 3.5 acres somewhere that's the county has that's sitting, it's vacant land. I believe we've mentioned this before, and I don't know if there was a 5-acre minimum criteria. So if there's 2.5 acres somewhere, if there's 5 acres somewhere, and you could put several duplexes on it, and that's low-income housing, that would allow somebody to get a place to live. We know that Continuum of Care's effort is looking for affordable housing. We know that our HUD director is looking for affordable housing. We know that veterans are looking for housing. So there's a multitude of possibilities for housing, not single-family homes per se, but what would be a development project similar to what Victory Gardens is. As Supervisor Miller points out, we did a partnership. We gifted land and however that structure was planned and moved through. So Victory Gardens is an example of a partnership that was created. So I think that fits the criteria of what we'd be looking for. Now,
okay, so you'd like for us to come back with a list if there's additional properties between, it sounded like, I think I heard you say like 1.5 acres, between the 1.5 acres and 5 acres, you're looking for us to see if there's additional properties we could add to our list.
Whatever property we have that would be suitable for development, in particular for something that would be considered not single-family home, but might be a duplex, might be a small apartment complex, it might be an expansion of something that a developer would say, I can do veteran housing. I can do low-income housing. I can do Section 8 housing. I can do housing in some capacity, not single-family, but something that would help the shortage we have, which is apparently 44,000 doors shy in San Joaquin County of current housing needs. So anything that fits the criteria, working now with stepping up, working with Public Works, if we had an acre of land that's 10 miles outside of the parameters of any and every type of city or county hookup, and we could not do sewer, water, electric, anything, that would be a piece of land that we would say, no, that wouldn't be suitable. Okay? We want to narrow it down now to what would be suitable, and we would put it out to see if anybody wants to partner with the county and do something like this.
Chair.
Yes, Supervisor Miller.
In the case of Victory Gardens, as with most of these other projects, the coordinating entity has been the CAO's office. So what I would like to see is for Ms. Cunningham and her team to perhaps expand the inventory a bit and then coordinate with our county administrator to either initiate conversations but to pursue this in whatever would be the most expedient way, and then come back to the board when there's something a bit more concrete. Sure. As opposed to us just looking at inventory, that doesn't really help us. It's going to have to go through the CAO's office, which is how Victory Gardens, how all of these partnerships have gone through. So I would like to suggest that perhaps Ms. Cunningham and her team coordinate with Mr. Wilverding and talk internally, whether it's with Public Works or with Mr. Ragsdale, or there's perhaps local developers, whoever, but then come back to the board when perhaps there's something a little more concrete for the board to look at. I think that might be more effective for us.
And would you agree that I think we have to identify the land before we talk to a developer? You have to identify what's available, and then the developer would say, yes, I could utilize this in some capacity.
Absolutely, and that's why I think Ms. Cunningham's team should provide that to the CAO.
Sure.
And let the CAO sort of orchestrate the effort, because it's about a lot more than just saying, well, here's 3 acres for you. I mean, when you look at what the hoops we had to go through to get Victory Gardens, it's still not out of the ground yet, but to cobble the financing and everything together is just so complicated. And it's going to take our CAO to be able to speak that language with potential developers, figure out if there is a potential on this. And then I'd like it if our CAO then is prepared to bring that back to us.
Great, I agree. Sounds good. Thank you very much. CAO Wilverding.
Oh, I'll just say I'll be happy to take a look at that. Thank you.
Great. Thank you.
Thank you. Just exploring all the possibilities. I appreciate all the time. I know it's in the process of the many things that are going on, it's like this one extra thing landed on your lap, but thank you for taking a dive into it and using our staff to see what's possible. Thank you.
You're welcome.
Your microphone's off, but please, you have a public comment. Please read.
Is it working now? There we go. Okay, the public comment was submitted by Dan Taveras Areola, a council member, City of Tracy, who writes, as a council member for the City of Tracy, I implore the Board of Supervisors to reconsider its position supporting a countywide super shelter for people experiencing homelessness. 100 words is utterly insufficient to express the absolute dereliction of duties that would occur should the Board of Supervisors invest all of its homelessness funding towards one super shelter that does not overcome the constitutional barriers in the Martin versus Boise case for each of this county's cities, including the City of Tracy, which do not currently have public shelter space for people experiencing homelessness. Let's work together for a real solution. And Chairman Patty, that concludes our public comments.
Unsure how that's related to the subject, but given the time that we're talking about emergency homeless shelters, we could maybe save that comment and share it again.
It was submitted during the discussion of this item, so that's why I'm assuming it based on what's on the agenda, that may have been intended for this item. But perhaps, if not, well,
I would imagine that person is without the true
connection to what we're watching. Maybe you watched an old discussion item and he's queuing in on it, because we're not talking about homeless shelters right now at all. So if you want to share that person's email address, if they provided it, or a phone number, I'll reach out to them and have a further discussion. But I appreciate that. Thank you. Moving on now to discussion item number 2. Amend and retitle the exempt confidential job classification for Board of Supervisors Legislative Assistant to Board of Supervisors Chief of Staff and establish a one-step salary rate. Ms. Hopkins.
I think the microphone's on now. Good afternoon, members of the board, Chair Patty, CAO Wilverding, and County Council Miles. Thank you for your time today. Human Resources is here this afternoon to present, as Chair Patty said, a request that the Board of Supervisors amend and retitle the exempt confidential job classification for Board of Supervisors Legislative Assistant to Board of Supervisors Chief of Staff and establish a one-step salary rate. As you are aware, the board directed Human Resources on February 9th to review the current Board of Supervisors Legislative Assistant job specification and salary structure. Human Resources has conducted a 10-county survey in which we reviewed Alameda, Contra Costa, Fresno, Kern, Sacramento, Santa Clara, Sonoma, Stanislaus, Tulare, and Ventura for how their current board legislative aides, there's a variety of titles that are used, but for what we're proposing to be the Chief of Staff. It was deemed that Santa Clara was not a match. They use a variety of different job classifications and titles for the same purpose, but we'll be discussing those results in a minute with you as well. Human Resources also met with each of the 4 current legislative assistants for their feedback and input into the process, and that resulted in the amended job specification in front of the board today that's recommended for approval, including the job title change to Board of Supervisors Chief of Staff. The process also included Human Resources conducting a salary survey to ensure that we were competitive in our current salary. Our current salary is minus 3.9% of the market median of those 9 counties that I just mentioned. It is important to note for the board that the job classification previously received a 2% cost of living adjustment and a 2% equity adjustment in October of 2020. One of the things the board asked Human Resources to review was the salary structure, how the actual classification salary structure looked in our 10 comparable counties. Again, what we saw was a mix. 3 counties use a min, mid, max range, and 6 counties use a step system. Some have 5 steps, some have 10 steps, some have flexible steps, depending on the county and how its structure is. We also did look at job titles, and there was not a consistent job title that was readily apparent throughout the process. 2 counties used field representative, several counties used board representative. We also saw board assistant and chief of staff sprinkled in there, depending on the county. In many cases, the chief of staff also supervised other board assistants or legislative assistants. The board also requested Human Resources review the current salary of current staff, your current legislative assistants. We are in the process of concluding that and will be providing to the board, as outlined in the board letter, an administrative process to make those adjustments. Human Resources has briefed the interim CAO Lopez. We briefed our current CAO Wilverding yesterday. Based upon some feedback that we've received with both of them, we'll be working with County Council to finalize those adjustments and processes, and we will be sharing that with our Board of Supervisors and the Chief of Staff, the drafts. I anticipate that to happen in the next pay period. The range that we're looking at to make those adjustments is approximately $3,600 to $15,000, depending on how long the board legislative aid has been with the organization. So before I open it up for questions and comments, just a reminder that it is recommended that the Board of Supervisors by board order retitle and amend the exempt job classification for Board of Supervisors Legislative Assistant to Board of Supervisors Chief of Staff, authorize the chair to sign the amended job classification, and then establish a one-step salary rate equal to step 5 of the current salary range, which is $3,042 biweekly, effective March 15th, 2021. The effective date was originally, we had planned to go to the board at the last board meeting, and then this got pushed off. So that's what has the retroactive date. May I answer any of the questions that the board may have?
Just for clarity, you had your opening statement, you had said that by board direction, I believe it was HR that had recommended a course of action for us to take for policy and procedure. It wasn't necessarily board direction. We had received from you, and you brought back to us, we had given you a request to bring back a review of what our policy and protocol would be. And 2 weeks later, you did, and that was the recommendation to bring everybody up to that single tier. So I was a little bit confused in the beginning when you said under board direction, we had done this. So I was maybe a little clarity on that.
Thank you for the opportunity to clarify. During the February 9th meeting, the board had discussion about updating and amending the job specification and the job title. And we took that to mean the board direction to come back to this board with the amended job specification that we're bringing to you today.
Based on the recommendations from HR.
HR participated in the recommendation of the particular incumbent, I think you may be referencing. HR didn't bring forward a recommendation about the job title or what the job classification might look like until today.
Correct. So it's the board direction for job title that you're addressing right now?
Yes, the board letter today is our final recommendation to the board for this board letter today.
But we're also addressing single step pay.
Yes,
so that was a policy and procedure discussion that you had established. It wasn't board direction. HR had been tasked with coming back to recommendation to the board. You came back with a single tier, and you got feedback from a couple of board members thinking that it was, validating that yes, it's equal pay, equal amount of work, and so that was an HR recommendation. We didn't advise you to do that.
I believe, Chair Patty, if we go back and look, and I've listened, that it was also the board's direction to do so. Several board members requested that as well. Okay,
I wanted to be clear because I know that prior to that ratification of the single tier, it was an HR recommendation that we go to a single tier. That said, when you were finally able to complete your survey of the 4 existing chiefs of staff, what did that yield? I didn't see any results of the questions or survey that when you spoke with them. Were they unilaterally in favor of the single tier? How did that discussion go with them?
So the discussion that I had with each one of the current board assistants at the time was related to scope and job duties. It was related to salary, and as with any group, there were varying opinions on many aspects. I believe in the end, receiving their input, that this reflects what the majority of them were comfortable with. They also gave significant significant information and input to the job description.
Okay, so now I had been given different information that the majority of the legislative aides, as they're called, or chiefs of staff, were not in favor of a single tier. So it's your survey then indicates that by majority they were in favor of, because that's not what I'm hearing. So I was just kind of curious how that interview went. If we've adopted new policy and protocol, and where that policy and protocol is established by. So we also know we've discussed in the past a pay disparity and kind of equalizing that, because some people were not hired with the top tier based on the entry level at the time, whether it be level 1 or level 3, whatever the alphabet it might be, or at the top tier level 5. So where are we at with covering that pay disparity for those that worked here?
Thank you. So I mentioned we were able to brief our CAO, Wilverding, yesterday. He had a few questions. We're going to get some input from County Council, and we anticipate the administrative recommendation being back before the board within the next pay period.
Okay. Is that coming to the board for approval, or that just automatically gets taken care of?
It's an administrative process, so once we've provided it to the board, we will go ahead and administratively make those changes.
Excellent. And then, so they'll be backfilled, so to speak? There'll be compensation for the...
Yes, there will be a pay
equity? So
adjustment.
They'll get top-tier pay from the day they were hired on.
That is what we're working on, correct.
Okay, excellent. So then, County Council, I have a question for you. I've got a couple of people who reached out to my office that were former employees, and they feel that it's disparaging to them that they were hired at a lower tier than top tier. Is there a legal jeopardy to the county, or do we just go back and make everybody whole? Let's say in the last, we've got Supervisor Wynn's Chief of Staff has been here the longest. So if we went back, let's say the last 20 or however long she's here, those 20-something years, and if we're making Supervisor Wynn's Chief of Staff, Ms. Warmadin, whole for the last 22 years, justifiably so, because we are now establishing that it's a top-tier job and everybody needs to get equal pay. So the other legislative aides that worked in the county that have been, there was perhaps a prejudice against them, and there was a disparity in the pay that they didn't get top tier as we've established, but we're backfilling those that worked during those years. What perhaps jeopardy does the county have, if any?
I don't believe the county has any jeopardy.
Okay. Would it be fair, because we certainly don't want to have any type of allegation that there's some sort of disparity, that it was something unfair how they were treated versus how we're treating employees now? Is there any vulnerability under that parameter?
People will always make allegations. I mean, if they didn't make allegations, you wouldn't have a need for a county counsel's office. So people will always make allegations. The board always has the ability to make adjustments to the manner in which you compensate your current employees. The fact that somebody was previously an employee really has no impact. And as the board, you can make a decision that, as is being recommended here, that benefits the existing employees. You could make it just on a going forward basis. Mm-hmm. Either of those are acceptable, and they don't establish any jeopardy.
Understood. Okay. I mean, we live in a litigious era now where people can bring in lawsuits. So last 2 points, I'm without my notes, must be back in my office. But at some point, it was established that as I'm the current chairman, my legislative aide, my chief of staff, is getting more money than other legislative aides or chiefs of staff. And I would dramatically establish that that's unfair. Also, I think there's life insurance issues that, there's different pay disparities for life insurance based on tenure or years. There was something I saw a note about that, but that's not my big issue. I know that equally, all of our legislative staff, even though I'm a current sitting chairman, we have legislative staff, our chiefs of staff, I have to get used to that, that are in the office. I know, again, Supervisor Wynn's chief of staff is there, as often as I can imagine. I don't believe it's fair for there to be an inequity just because my chief of staff is working with the current chairman of the board. We all equally have elements of hard work that we do. Supervisor Wynn, just this last weekend, was 7 days a week. He's out there helping his district and doing events, and his chief of staff is right there with him. So there's a pay disparity there. And then lastly, I was concerned that, and I think recently, if I understand correctly, the prior measure actions, before we've come to this new realization, but prior action, I believe Supervisor Miller and Supervisor Wynn would have been present, but there was a seniority pay bump.
that somebody had been here for 20 plus years, they got a pay bump ahead of others. And that also seems like an inequity, because if my chief of staff is working as hard as somebody else's chief of staff, is that 20 years now establishing that you actually know what you're doing above everybody else? Or do we all hit the ground running as we've established, because it's a very difficult job and you are constantly called upon and you are constantly working. It could be 7 days a week. So that pay disparity, because of seniority, seems like a bias. It seems like it's something that's unfair to all of the other legislative or chiefs of staff. Forgive me, I keep digressing. But the other chiefs of staff that work as hard as that person that's been there for 20 years. So I just think these are important points to talk about as we've established that that's a very difficult job, not only for recruiting, but it's a very difficult job, all hands on deck. So what do we do about that, these pay disparities that I mentioned, Ms. Hopkins?
Oh, thank you, Chair Patty. A few of these I may need to go back and do some research for you on. I'm not sure why your chief of staff is making more unless this county gives a stipend to the chair's chief of staff, which is fairly common. I need to look into that. I will need to look into the life insurance. If you're talking about a seniority bump in pay, I'm not sure if that's a reference to the longevity pay that the board recently approved back in October.
This goes back several years.
Okay.
I believe, and again, my notes are in the office, but I believe it was like if you hit that 20-year mark, there was a bump. And Supervisor Miller might know better what that was, but it was just amongst my notes that I had, and I said, well, that's an inequity. So I really didn't think that would be fair. So I believe we need to address these issues because we want fairness and equality for all. And having a department or department staff that's not paid with equity is disparaging.
I'll go back and research your points.
Excellent, thank you. Any other board members care to discuss anything on this issue?
Chairman Patty, if I may.
Yes.
I can clarify that your chief of staff and each chief of staff for the chairman does receive an additional stipend for that year because they are expected to have additional duties serving as the chairman's legislative assistant or chief of staff.
Yeah, but I know all chiefs of staff are working hard, so I think that would be unfair to the others.
Each chief of staff, when their supervisor is the chairman, they also receive that additional
Understood. Understood. But I know my chief of staff, whether I'm chairman or not, is working constantly. I know that all of our chiefs of staff are constantly working. When we've established, even if you hire somebody who's never had a job, they hit the ground running, and we know they are drinking from a fire hydrant right away. As Supervisor Wynn points out, that it's a difficult job right from the beginning, and you're turned on and relied on, and it's a staff of one. So I just wholeheartedly believe that all of our staff works hard. And if we're going to have a single entry tier, then I think there should be a single pay all the way through. I think that would be fair. Otherwise, there's a disparity. How do we establish what's more fair than another? So it was just a little concerning when I saw some of those disparities. And we are pushing for equality for all. Supervisor Villapudua, you have a request to speak? No, okay. I'm trying to I got requests here. CAO Wilverding, I have a question. Nope. Okay.
I do.
Supervisor Miller.
Thank you. I'm wondering if any of these longevity increases are tied to SEIU. I know that our raises are tied to that particular bargaining unit. I don't know if this is part of that. I will say, I'm not sure if the chair is aware, but the chair also gets a salary bump for the year you serve as chair because of the additional.
And I believe that's another subject, but that should be equal because we all equally work hard. There should be no disparity.
I just wanted to make sure that, I believe that that's what that is tied to.
Wholeheartedly
So
unjustified.
I don't have any issues with that. I do know that depending on what occurs while you're chair, the increase in time expectations can be huge. if there's any kind of a crisis. Supervisor Wynn served during a flood crisis in this county, and the time that you are simply required to be places, and because of being chair, it can be a lot greater. It can also be quite a bit more onerous on your chief of staff, because there's a huge increase in the amount of things that have to be signed. And a lot of times your chief of staff is running around trying to facilitate all that. But be that as it may, that's a discussion for the board. But I'm wondering if specifically that longevity might be tied to things that have come up with the SEIU contracts.
And I'll state, if that's the case, if somebody's working there 8 years, 10 years, 12 years, or 22 years, if there's the longevity clause, everybody should be equal. So I don't think that's fair. We need to examine that and take a look at that. It's clearly the precedent we've established, so we need to see this through. It shouldn't be selective just for our chiefs of staff. We have people in this county that look at this board. We've established precedent, and I think we've established the new policy and protocol, thanks to Ms. Hopkins and what you've suggested and brought to the board. So we have to look at this across the board of how we could be fair and equal to people that work and depend on San Joaquin County for that type of equity. Supervisor Wynn.
Thank you, Mr. Chair. Hopkins, my recollection was that in our discussion in regards to the legislative aid or chief of staff pay was that for Supervisor Miller's appointee, there was going to be a salary range that was introduced. And there was a concern in regards to those who have been hired previously in that position that didn't enter at that step. And therefore, there was a disparity. And as I recall, I think I just simply said, well, why don't we make it a top step? And for the inequity, I guess, for, I assume, Chair Patty's chief of staff, that the difference between what he would have been paid had he entered at the top step and to currently would be reimbursed or adjusted. That's what I recall in our discussion. It was pretty straightforward and simple. One, the name change from legislative aid to chief of staff, which a lot of them are using anyway. Secondly, was just the simple matter of making Chair Patty's chief of staff, I guess, whole, so to speak, compared to being disadvantaged by entering at a lower pay scale. That's pretty much the discussion that I recall. I don't know about all these other things, but again, in regards to the bump for the chair's chief of staff or the chair themselves, maybe Chair Patty, because you don't have a full-blown open economy, excuse me, which you will have probably in June or July. The chief of staff takes on a lot of additional responsibilities. Chair Patty was on vacation or out of the office, and I came up and signed, literally. I mean, we're talking about 3 stacks of documents that the chair normally signs. But in addition to that, what normally happens with the chief is that the chair, is that they represent the county, and therefore, as my tenure, and I'm sure Chair Miller when she was chair, and I know Supervisor Villaputo when he was the chair, is that you go to a lot more events, because when there's an event and a presentation, the chair makes that presentation. So in addition to all the other meetings I went to, and as my district representative, I went to a whole bunch more meetings as the chairman of the board to make those. So there is and it probably hasn't maybe surfaced with maybe the last 3 months, but I would tell you in normal times, the chairperson experiences a lot more work than all the rest of us do. And I know we're all busy, but I think, all chairs and previously have gotten that additional adjustment. I didn't know that the legislative reps got that, but that's true because they go through a lot more work for no other reason. Scheduling, documentation, just a whole host of things above and beyond their district duties. So I have no problem for either the chair or the chief of staff or the chair getting that additional bump because they do have a lot more work to do. The other part of it in regards to just that part that I recall our discussion was simply, and going back, 22 years from my, I'm not sure that maybe Supervisor Rickman's chief of staff is the most senior, because I think he did, 10 years for Supervisor Ornelas, 8 years for Supervisor Elliott. So I don't know. And my chief of staff has done 16 years with 2 previous supervisors and 6 with me, so maybe she has the seniority. I don't know. Doesn't make any difference. But I guess to talk about going back to her tenure or anybody else's tenure, it would seem the discussion that we had at the board previously was simply to go back and make Chair Patty's chief of staff whole because he was hired at a lower level. That was the only thing that I heard us discuss, which means any adjustment made for him or any other chief of staff that's been disadvantaged by being hired at a lower step. And I don't think my chief of staff would care because she's obviously been there and went through the steps years ago. But my point is that those are things that I think are fairly simple and that longevity or all the other pay, as Supervisor Miller brings up, I don't know anything about those, or life insurance. And I guess in this, I think County Council has already answered the question, but this is a situation where the board is trying to fix a problem or an inequity that occurred as simply as possible. And I think we did that, at least initially I thought we did that. The other part of it is, and I appreciate, certainly the surveys and all the things that have occurred. However, I do disagree in regards to the recommendation of the current salary. And by the way, this was prompted by me, not my chief of staff. I just asked her to pull it up. But aside from your study and comparisons, actually district chief of staff in 3 different counties, one being Madera, and this is only 2015, but at that time they were making $36 an hour, which is less, but I don't know what it is currently because it's 6 years late. And that population of that county is 157,000, which is fewer residents than my district alone. The second one is the Monterey County, which has a population of about half San Joaquin, and their pay rate is $47 to $65 an hour for their chief of staff. And the last one is, and by the way, that is September of 2018. And the last one is in 2014. And this is I think it's Ventura County, and their pay is $39 to $54 an hour. And again, that was in 2014. Again, chief of staff. Now, I would acknowledge that the higher ones in their job description, I don't know what it is, but they do supervise someone. So that component is not in our particular job description. But I think just those particular those particular counties and that particular position, which mirrors what we basically have here, I think would warrant further scrutiny. And as opposed to having your time to go back, I'm assuming all these are increasing, which means they're much higher than they currently were. But I would say that that in addition, and I understand the rules in regards to, the median base salary and within 5%, et cetera. But median does not mean the most, and it doesn't mean the least. It just means the middle. And I would say, based upon just those 3 counties and certainly what you've done in regards to your survey, I would argue that I would say that that just to start on a new level, so to speak, and it's not exorbitant, but that we would bump up their pay by just round it off to 4%. And that would be the base from here on out. And for all the future pay increases, which are tied to SEIU for us, and I'm sure for them, that would be my recommendation. And again, we're talking about essentially about $3,200 a year for each, maybe a total of $16,000. And this board has spent a lot more money on consultants and a whole bunch of other things that are much more than that. So I think it would be reasonable. And as county council says, this is something the board can decide. And I understand, there will always be people who complain about, why not me? Well, we're dealing with the current situation with current chiefs of staff and current problem, and I think we can solve it. So anyway, my input would be that we approve your recommendations as regards to the title, the job description, that we give their salary a 4% increase, that we go back to Chair Patty's chief of staff when they came in, which was at a lower rate, make them whole, and anybody else from that point, from that date forward, that received any kind of inequity, that we make them whole. And any future appointments for supervisors here or new supervisor, replace myself and Supervisor Miller, that their chiefs of staff would be brought in at the top step, period. That's my take on the whole process, and I turn it back to the chair for other supervisor comments.
Thank you, Supervisor Wynn. I believe that prior conversation we had spoke with making everybody whole again, and that would go back to those that were hired at a lower tier that are here that really feel as though it was disparaging to bring in somebody that's relatively new without that job experience, as they all entered without exact job experience, and for that person to get the top tier and they didn't. There was a lot of hardship, a lot of hurt feelings, and a lot of what they feel is an unfair advantage given to somebody. So I believe if we're going to have that as a policy, we go back to that longest serving person's tenure when they began. I mean, Scott Terrell, from what I'm told, when he reapplied, he had to reapply to work for Supervisor Elliott, and he got brought in at level 1, the lowest tier, and he had to work his way back up to level 5. So, these people that, even though he had institutional knowledge, that's what the supervisors decided to do with him and to approve his hiring at the time. Since then, of course, you have come to us with the recommendation of a single top tier pay, regardless of experience, regardless of entry, regardless of anything, just a single top tier. And that's the policy and protocol from HR that we adopted. Let me state for clarity that this board never voted against somebody being hired based on anything in any capacity other than, and there was no vote at all. There was never a 3-2 vote against hiring somebody. Staff was directed, and at the time, Supervisor Miller was going to talk with their prospective employee about if they were going to flex or move that schedule. You were going to do an investigation and talk to supervisor, chiefs of staff, and come back with recommendations to the board. And so that recommendation, based on that HR recommendation of what our policy and protocol would be, is how we've established the top tier. Not because there was any type of bias or impartial or racism or sexism or any other ism that many of us board members were accused of, which, by the way, for this record, there's never been a public apology on those allegations, lies, and slander. But again, that's another subject. So I believe that when we had that discussion, I believe we are best suited going back to the furthest point in time when somebody was hired, whether it be Mr. Terrell or Chief of Staff Denise Warmerdin in Supervisor Wynn's, and from that point forward, they should be hired at the top tier pay of whatever it was at that time, and they be made whole. Establish that as the policy and protocol for hiring of a legislative aide. So that's where I'm at with this.
I have a real quick, Chair, if you don't mind.
Supervisor Rickman.
I agree in the fact that, if it's not fair now, then it wasn't fair then. So, just letting two individuals instead of the rest of the staff, I just think that's unfair. And I know I have the paperwork. I actually have a huge old binder that I did research on this. And I know my chief of staff was hired at the lowest possible tier. I think back when he was hired, it was 1. And so how fair is it for him or Supervisor Wynn's chief of staff? She was at the lower tier too. How fair is it for her? If we're going to change the rules, and it has to be fair for everybody.
Supervisor Rickman, through the chair, HR is completing analysis on all 4 of the chiefs of staff that will be presented to the Board of Supervisors. So we are looking at all 4 of them.
Right. It just has to be a level playing field. It has to be fair across the board. So that's where I stand.
Good. Thank you. Anybody else? Supervisor Villaputo, anything? Supervisor Miller, circling back to you. We're all good? Okay. I think we have staff. I think Supervisor Wynn, did you want to make a motion?
Yes, I would, Chair. I would make a motion that we adopt the recommendation in regards to the title, job descriptions, and I would add that in addition to bring them up to a median salary, which is not the highest, that they also receive a 4% pay increase at the top step. And I'll defer to the chair and to Supervisor Rickman and to Ms. Hopkins in regards to the adjustment, I guess, so to speak, and you've already said you're going to move forward on that, so I'll leave that in your hands, that we adopt the recommendation as far as title, job description, and I add the pay increase for all of our chiefs of staff from here on out. So that's my motion.
Do I have a second? All right, please vote. Fantastic. 5-0. We are done with that. We are now moving on to our Board of Supervisors comments and committee reports, starting with Supervisor Miller.
Thank you. I'm going to request that Supervisor Villaputo and I have a joint report out from the Women's Committee, and I'm going to ask to go after Supervisor Villaputo because his portion of the report should come first.
Fantastic. Thank you. Supervisor Rickman, do you have any reports or committee reports?
I just have a question for our council and a request.
Sure.
You want me to go now, Chair, or want me to wait?
You want to wait?
It doesn't matter.
Go now. I've called on you.
Just a few quick things. Myself and Director Balaji have been working with South County in regards to truck traffic, and I know I've asked you, Mr. Miles, for some information. I've been waiting for a month now on it, and I haven't got a response. So is there going to be anytime soon, or would you rather me, or should I agenda it in order to get a response?
Supervisor, we have gone back through the codes. I got an updated response from one of my attorneys yesterday that I've got some additional questions on it. I will get you a response by the end of the week.
All right, thank you. I know I talked to Director Balaji. We're making great progress, but we're at a standstill right now. We need this information in order for where we're going to go forward. As to Mr. Miles, our PRA, where we're at, I mentioned that earlier. So can you build on what we're doing now?
Yes. So I had previously sent 2 Public Records Act requests to the CDPH and had asked for essentially the documents that showed that they had applied their analysis to the various steps in order to reach their determination about what would be open and how many people would be allowed in a particular type of business at a particular level within the blueprint. I also asked for similar documentation on how they made their determinations related to reopening youth sports activities. I received the initial 10-day response back that said, we're going to take additional time. From that gives them under the code an additional 14 days. So then a month later, I did get a final response on both of them that said, that information, we're not giving you anything. It falls under all of these various protections. I sent 2 additional CPRA requests. And these 2 additional CPRA requests, I simply ask, send me all of the documents where you, because in your letter, CDPH, you represented that you were contacting all of these departments and that you were, so just provide me with those documents to establish that you actually did reach out and try and do this thing. So I've sent those 2 CPRA requests. Yesterday, I received the responses, the initial 10-day response on those. Not surprisingly, they've said, oh, we're going to take advantage of our additional 14 days. So it will be another 2 weeks before I get the final response. We'll see if they provide anything. I don't expect that they will. Once we receive those, then it will be my plan to come to the board in closed session and have a discussion with the board about how to proceed.
Thank you. I was just going to say if we could schedule a closed session, but you're on top of that. And my last thing, Chair, is what I mentioned today, which gave me pause or concern about proof of vaccination. And is there, a proof of vaccination and taking part in everyday life, like at sporting events, patronizing businesses, gatherings and stuff. And, that does raise questions of equity, raises questions of privacy, and even possible HIPAA violations. Is there a way we could look at, and I'm getting, board's opinion on this, in ordinance preventing the collection of that, or asking that question or collection of that data on a countywide level?
When you say collection of that
Not
data,
collection, or prohibiting the asking of that information in required to do part in everyday life.
so prohibits asking for proof of vaccination
from an individual.
Preventing a level of enforcement is what you're asking for.
Well,
is
not
that
even
correct?
a level of enforcement. I mean, what right does an individual have to ask another individual? We have protections for right to privacy, and especially when it comes to our medical privacy.
Mm-hmm.
So can we prohibit the asking of that question? You're seeing it in other states right now, for example, in Texas and in Florida, and I think it was another state.
So specific with the vaccines for COVID and specific to, when you say, the everyday life, like as is laid out in the modifications to the blueprint where it shows.
Right. For example, if I want to go to a restaurant, right, and, okay, well, have you been vaccinated? You either tell me yes or no, or you're not coming in. Or do you want to go to a sporting event? Same question. If I want to go to a movie theater, and you can see where this escalates, the slippery slope keeps on going. And, and I think that's absolutely abhorrent, excuse me. So there's something we can do as a county to prevent that from happening.
We'll look into that.
And actually, we'll talk here offline and related to that. And that is it, Chair. So thank you for indulging me.
Sure. Supervisor Villapudua.
Yes, sir. Thank you, Chair Patty. Happy to announce that we've had 2 successful women's committee meetings along with Supervisor Miller and our DA, Tori Verbert Salazar. And we do have a mission statement I'd like to read right now. The mission of the San Joaquin County Women's Committee is to improve the conditions and the status of women in San Joaquin County by implementing gender equitable policies for the recruitment, compensation, development, and promotion of women employees in all of San Joaquin County departments, and gender equitable allocation of resources and service delivery to the residents of San Joaquin County. It's been a great 2 meetings, and I'll let Supervisor Miller comment. Thank you.
Well, hold on. Before you pass it on, didn't you have an amazing family event over the weekend? Not only did you do that, a family event at Stribley Park, right? And then you also did vaccinations and testing. That's outstanding.
As for pay, we served probably, 300 to 500 people, and we had all sorts of free stuff for everybody in the community, and it was a really good event. Thank you, Chair Patty, for bringing that up.
Outstanding job representing your district. Good job to you and your staff.
Thank you.
Supervisor Nguyen, did you have anything to share today?
Not really. I mean, obviously we all go to meetings, and Supervisor Rickman's gone, but the latest I've heard in regards to the vaccination certificate, at least from Dr. Fauci, is that, and this is only for now, supposedly that he doesn't believe that they need to have that from issued or mandated from the government. Although I also hear the talk that businesses, as I think Supervisor Rickman is alluding to, businesses, airlines, for example, restaurants, other businesses may require some type of documentation that you've been either vaccinated or you have tested and have the antibodies to access your facility. So it's going to be a real issue because even though the governor has said, he's, I guess June 15th, maybe that's a 70% vaccination rate that he's talked about in the past, but there is going to be an issue in regards to one's ability, one, to not take the vaccine, or two, not to get some type of certification, as was said earlier, sometimes that disadvantages our lower income residents. So that's all I have. Thank you.
All right, thank you, Supervisor Miller.
Thank you, Chair. As part of the San Joaquin County Women's Committee, the work going forward, we have set up some work groups to delve into some specifics. One of the underlying principles is going to be that anything that comes out of this group is going to be based on data, on real numbers, not just on speculation or anecdotal. We actually have a work committee on data and demographics. So that's going to include a review of the most recent EEO report and a little bit deeper dive into those numbers. We are going to have a committee on budget analysis and resource allocation, developing some systemic metrics to make sure that our budget allocations reflect the priorities of equity for San Joaquin County. We also have a committee looking at developing a mentorship training program to create a strong pathway for leadership among our women employees, and also to identify some barriers that make it more difficult or impossible for women to move up the ladder. We have a work group that is going to identify and, if found, analyze any unconscious gender biases in our salary structure, our classifications, our recruitment processes. And finally, we have a group that is going to be looking at supportive services and a means for the county to provide alternate resources for our women employees. So we're moving forward with the work. It's a great group. Hats off to Supervisor Villaputua for being the only male member of this committee. He's doing a fine job, and I'm looking forward to seeing this information come forward. Finally, I would like to make a request of the chair that we close our meeting today. I found out from County Council that Sunday morning Mrs. Joaquin Nguyen passed away. For anybody that's been in elected office in this county in the last 30 years, Mrs. Nguyen was a fixture. in this area at public meetings, county meetings, city council meetings. She'd sometimes show up to planning commission. She was all over, and she spent all day on Tuesdays going to public meetings and making comment. And she was an immigrant to this country, and her faith in our system that her voice mattered. It was really kind of, I mean, I've been on the hot seat many times, Mrs. Wynn saying, shame on you, shame on you. She would get up and scold us and call us out for things. And sometimes she drove us all crazy, a bit crazy. But her faith in our system was really something to see. Quite frankly, as I've said many times, she had a better attendance record than some of our elected officials showing up at meetings. And so it's really kind of the end of an era for anybody that's been in local government. So I would just like to close today in her honor.
Thank you, and that is very commendable. I'm glad interestingly, she was on my mind recently, so for whatever reason, it's current. I understand she was also a school teacher for many years.
Yeah.
So not only was she an educator and one that cared for our kids and the future generations, but she took her role as a citizen seriously and was highly engaged in showing up at the meetings, as you point out. So absolutely, we will close. Before we do close, I will give one or two quick reports. Last week, I had an opportunity to go up to Olympia, Washington. I was invited by our district attorney. They were going up and looking at, I want you guys to pay attention. You're going to hear this terminology, familiar faces and crew. Crew is a crisis response unit, and familiar faces is also using people that have been perhaps homeless or been through the prior incarceration, and they're mobilized through the police department as a response team in different aspects and different levels. So this is something that you've heard about in Eugene, Oregon. This is something that you've seen that they've incorporated into Olympia. And we had a chance to do ride-alongs with them. We had a chance to do spend time and really understand their levels of engagement. And really what you see when you hear about defund the police, I firmly believe that's a misguided statement. It's not truly the intent and the desire. But what they're looking for and what they found through Crew is a crisis response unit that was trained and well-versed in behavioral health issues. And while something may not be a law enforcement moment when 911 is called and an officer is dispatched, what started off as an outside agency is now being incorporated into the police department. And we had a debriefing yesterday, Supervisor Rickman, your name came up, but the chief of police in Tracy sent a representative, as did the chief of police from Stockton, and other chiefs of police wanted to pay attention, and they're very interested in bringing this into their cities, their respective cities. And so what works is that a police officer might be on site and realize like this is not a law enforcement issue, this is not a threatening environment. So they'll tag team, they'll call Crew, they can move on to the more challenging risks of law enforcement and the demands that are on those departments, and hand off to a Crew team, and that person will assess. They can bring resources, bring that person home. They can do a myriad of things that they're trained to do, and it's proven to be very effective. And ironically enough, while we're up there, there was a article in the Stockton Record about some citizens talking about an alternate to 911 and doing exactly this, and they noted the Eugene model. So our district attorney, Ms. Verber, as well as our police chiefs, are well aware of these resources that are being utilized and a different approach of how to engage with the public, and they're finding it to be of great value. So you'll be hearing more about Crew and familiar faces. So I was honored to go up there and look at how they're dealing with their homeless, what they've set up for mitigation sites, as well as partnerships in different agencies. So along the lines of one of the many things we need to be doing and are engaged in the county, this was some really helpful solutions. So that said, we are going to adjourn. We're going to take a 15-minute break in between now and closed session. I do have a question. We see in the back after closed session we have a presentation without people present on retirements, I believe, or is it, what do we have here?
You're correct, Supervisor. It's the Service and Retiree Award presentation.
Service and Retiree Awards. How long is that presentation? What is it? Please come on down. Let's do it now. I appreciate you waiting there patiently. You're taking the under 10 minutes to the extreme. You got it done in 3 minutes. I like this. Let's rock and roll.
Clerk of the Board, do you have our PowerPoint? Oh, and you have the... Hey, good afternoon, Chair Patty, members of the board, CAO Wilverding, County Council Mark Miles. Thank you for allowing us this opportunity to recognize our employees for their service awards this afternoon and our retirees. San Joaquin County Human Resources is proud to be part of our service award program, and the award program strives to recognize employees at milestone periods starting at 10 years up to 40 years, and we have a 40-year recognition today in 5-year increments. Employees with over 20 years of service are honored by the Board of Supervisors in an awards ceremony, as this board is very proud of. Generally, it's in person. You get to interact with the honorees, take photos, and unfortunately, because of the pandemic, this is our 3rd virtual awards ceremony. So we'll be honoring the individuals up on the screen with their pictures should they choose. The board does provide framed prints of reproductions of 19th and 20th century originals from the archives of the San Joaquin County Historical Society and Museum. We'll see a picture of those in a few minutes. And each employee has a choice of 45 historical figures, architectural, agricultural, or nature scenes. Today, the board will be recognizing 92 employees from 21 departments were eligible. 52 requested to be honored publicly today. Service awards cover staff who became eligible from the months of September of 2020 through December of 2020. We will also be honoring our retirees. 53 employees from 16 departments have retired since August 2020 through December of 2020, and 12 retirees were requested to be honored today. Again, Human Resources is proud to recognize the employees for their years of service and dedication to the community, and we appreciate and thank the board for providing this opportunity to express meaningful recognition. And we will start with our retirees and then move on to the service awards. So our retirees again are from August to December of 2020. Deborah Kahn from the San Joaquin County Employees Retirement Association, 36 years of service. Carter Little, San Joaquin General Hospital, 34 years of service. Vicki Delp, Public Defender's Office, 31 years of service. Michael Sanson, Employment Economic Development Department, 30 years of service. Joyce Weber, Assessor Recorder County Clerk, also 30 years of service. Jack Thompson, Public Works Department, 28 years of service. Christine Tapp from the Sheriff's Office, 24 years of service. Yolvanda Knight, the Human Services Agency, 22 years of service. Michael McDonald, Probation Department, 20 years of service. Raymond Hu, Neighborhood Preservation, 18 years of service. Judith Olunk, I may have mispronounced that, my apologies. Behavioral Health Services, 17 years of service. Kiea Williams, Community Development Services, 10 years of service. And that finalizes our retirees for this recognition period. Up on the screen, especially for the community that's watching, these are samples of the prints that our service award recipients are eligible for. We're starting with 40 years of service. Rikiko Simbayashi, Human Services Agency. Moving on to 35 years of service. Sylvia Izorida, District Attorney's Office. Dan McKeever, Public Works Department. Denise Odom from the Human Services Agency. Isabel Vasquez from the District Attorney's Office. Moving on to 30 years of service. Helen Brooks from the Human Services Agency. Diego Chavez, Public Works Department. Adele Flores, Public Health Services. Margarita Lung, Human Services Agency. Annette Lovato, Agricultural Commissioner's Office. Samantha Menard from the Sheriff's Office. Kelly Pace, Human Services Agency. Patricia Pimentel from San Joaquin General Hospital. Carlos Prieto from the Sheriff's Office. Kim Rickey, Department of Child Support Services. Alyssa Rosas, Human Services Agency. Milette Saison Martinez, Information Security Department. Recognizing our 25 years of service, Mary Franks from the Employment Economic Development Department. Rosalind Luna, San Joaquin General Hospital. James Nelson from the Sheriff's Office. Lawrence Newman, San Joaquin General Hospital, bless you. Mina Combe, Nora Vang, San Joaquin General Hospital. Chris Rose from the County Administrator's Office. Isel Anja, Vigil, Human Services Agency. Marcus Williams from the Public Works Department. Recognizing our employees with 20 years of service. Gurit Baharu, San Joaquin General Hospital. Carla Bombin, also from San Joaquin General Hospital. Iona Charles from the Human Services Agency. Billy Chavez from the Register of Voters. Ramil Dorino, Behavioral Health Services. Charlie Fu from the Human Services Agency. Danielle Frederiksen, Behavioral Health Services. Mona Jimenez, Behavioral Health Services. There we go. Anthony Goulart from the Sheriff's Office. Nicole Gunderson from the Human Services Agency. Kimberly Harris from the Department of Public Works. Vicki Harrison from the Sheriff's Office. Sharon Hawkins from the Agricultural Commissioner's Office. Paul Huerta from the Economic Employment Development Department. Faye Jacobs from San Joaquin General Hospital. Raul Hargretti, Public Works Department. Cynthia Letterdell, Human Services Agency. Desiree Rose Lozano from the Assessor Recorder County Clerk's Office. Rashina Martinez from the Public Defender's Office. Canada Nordyke from the San Joaquin General Hospital. Shelby Oliver from the Sheriff's Office. Rosa Pam from the Department of Child Support Services. Anthony Rocha from the Human Services Agency. Cynthia Sanchez from the Assessor Recorder County Clerk. Mary Shaw from the Human Services Agency. Kurt Shigemutsa from Human Resources. I'm so used to saying Human Services Agency, forgive me. Jenny Vu from the Human Services Agency. We just want to again take a minute to pause and thank all of our county employees for their hard work and dedicated service over many, many years. Are there any questions from the board?
Excellent. Thank you for those recognitions and retirement to those that served our county and are moving on. We are grateful, and the citizens of this county are grateful as well. I don't know if any board members like to say anything. I know that usually they're here in public and we can thank them. And if those that are paying attention, we truly are grateful. We work to the pleasure of the people in every capacity. So I don't know if anybody has anything to say, or Supervisor Villapudua.
Sure. Just want to say thank you for your years of service. For those of you retired, please have a great time. And for those of you who are still working here, I appreciate you and continue to enjoy working for San Joaquin County.
And likewise, thank you everybody for your dedication and service to our community. And real quick, and do we usually do a luncheon? Is that what you said? Or do we do something?
They usually are here present, so actually today's great discussion from the clerk of the board, we might be able to bring some of them in for the next service awards.
Right, I was going to say, I mean, apparently we're supposed to open up in June. This was Channel 13 or something the governor was talking about. So if that's the case, can we just bring it back at a later time so they can get the recognition that they in person?
That'll be really nice.
Yeah. And of course, that's up to the chair.
All right, thank you.
Yeah, I would just echo my thanks to all of our employees. The last year's been really tough. We really appreciate you. You are essential to the folks who live in this county, and all of you. And we appreciate your many years of service. To those of you who are retiring, we wish you all the best. A lot of happiness in your retirement. Thank you.
Supervisor Wynn.
All of you, those who retired, certainly those currently working, are really the face and the backbone of the county. We do a job just like you do, and we thank you for certainly your commitment, dedication, which makes our job a lot easier. One comment, for those who retired, I know it may be challenging, but for those who are working, could we have somebody go around and take their picture? It would always be nice, because sometimes we don't know their name, but we know the face. And besides that, it'd be good to see them since we recognize them. And again, you know.
Yeah, if I could just, we do give the option. So we send it out to all of the retirees and to the people receiving service awards, the employees, current employees. We give them the option to send a picture in. Some people are a little modest, more modest. And so we do give that option, but we would love to be able to have that opportunity since they can't be here face to face. So it's just those who choose to send them in.
Well, I was just going to say, you know, if you have somebody, I know everybody's busy, just take their camera phone and go out and just take a snapshot in their workplace or whatever. I think having a face to the name is always beneficial, not just for us, but certainly for those viewing. Thank you.
All right, thank you. We're going to take a 15-minute break. But County Council, before we adjourn our morning session, any announcements, please?
Board will meet in closed session on the items listed on the agenda. There are no announcements coming out of closed session.
All right, so we are adjourned for now. Thank you. Right.
you.